You're on there.
Good morning. The storage printer is not connecting to the Wi-Fi. The storage printer is they're needing to print. I was gonna see if all people got it connected.
Richard, can you hear me?
Now I can hear you.
Hey, Rod. I'm recording through Teams, plus I'll do the backup thing with this. Richard.
Did we hear Richard?
He ain't answering. He's muted right now. Let me give him a call. Because we could pretty much get this going. The only other one we're missing is Brandy O'Sullivan. And I think we got everybody else.
Paul's on there, right?
Yes. Where did he go? Yeah, he's on there. He's muted. No, actually, if you wanted to sit at the desk.
This one?
Yeah. You know, you don't have to be right in front of it. No.
That one or that one? This one?
Yeah.
It's gonna be with you guys?
Yeah.
It's just us in there.
Hello.
Okay. You said, no, you come over here. You can sit next to me so he can. That's okay, guys?
That should be fine, yeah.
I don't have a button for muting yet. Oh, here we go. There's,
Okay. I'm
Okay.
unmuted now.
all right, bye.
My apologies, everybody.
Will this line up? Will this one work?
Richard, is Brandy don't be joining us, or we don't be calling her?
She should be tuning in via Teams, but if necessary, we can give her a call.
All right, I mean, we can swear in when she gets here. It's 8 o'clock. If we want to move with this, I think we got everybody. I need to find out who
I'll use my own computer.
812 is. I don't have no idea who this person is. So the people I don't know, I'm on a mute. Who is phone number 210 area code? All right, well, mute.
You guys know the password to the local.
No,
Wi-Fi.
It's automatically in line.
Okay, let's see what this is.
Can you hear us, Mr. Paul? Okay, just so you know, you're muted right now. Okay. Well, I think
I got
we-
a nasty cold and cough, so I'm trying to spare you all of that when I
That's
don't
all
have
right.
to.
only one really we're
Thank
missing.
you, Mr. Lindenberger.
Only one we're really missing right now is Brandy O'Sullivan, but we can give her a call. I know Miss Angela. I can't really say your last name if you can hear me.
I can hear you, Larry. You're welcome to call me Dr. Angela.
Okay, thank you.
Yes, sir.
Because I have a heck of a time with the other one. I know you're short on time. And then here.
Yes, Stewart's Dr. Pelzel McCluskey. She does have a 9 o'clock appearance that she does need to get to.
Okay, Billy, are you ready? If we go on?
If we can have, I'm trying to log in here because I can't hear. And when I can't see you guys' computers, then I can't.
Let me see if I can turn this up a little bit more. I pretty much got this turned all the way up. That's as far as, you can look at Don's.
Will that work?
Oh, yeah, okay.
Would that work for you?
Yeah.
Okay.
Okay.
Well, we can do that while I'm trying to, since you guys don't know password.
I'm in here and can't talk. Jesus.
You guys are important.
No, we're not. Okay. If everybody's ready, we'll go ahead and start this because I know Dr. Angela needs to get going. She has another appointment. So today is October 23, 2024. It's approximately about 8:05. We are here for a hearing for Mr. Heath Taylor, trainer. I want everybody to state their name and how they're licensed or how they're affiliated with this. My name is Larry Fontenot Jr. I'm the state steward.
Reese Howard, State
Oh.
Steward.
Don Rouse, State Steward.
Leave it on for Billy.
Richard Bustamante, in-house counsel for the State of New Mexico Racing Commission.
I just heard you. Go ahead and say your name again, Don.
Don Rouse, State Steward.
I'm Billy Blackburn. I'm a lawyer for Mr. Heath Taylor, and we're here in person at the steward's office. And present with me is Heath Taylor sitting next to me.
You just state your name and how you like your name.
Heath Taylor, licensed trainer.
Paul Lindenberger, also appearing as counsel for Mr. Taylor.
Dr. Angela, just please state your name and how you're affiliated.
Yes, sir. I'm Dr. Angela Pelzel McCluskey. I'm the National Epidemiologist for USDA APHIS Veterinary Services.
Okay, thank you. For everybody that's going to be given testimony, please raise your right hand. We're going to do this on the honor system. Do you swear to tell the truth, the whole truth?
Yeah.
Okay, thank you. Just say yes, please, Dr. Angela.
Yes, sir.
Okay, thank you. All right. I just want to verify that Mr. Heath Taylor, you have been properly noticed on this hearing today?
Yes, sir. Yes, sir.
Okay, thank you. I just want to explain this hearing is quasi judicial in nature. We are not bound by the technical rules of procedure and evidence. Which, well, I'm going to explain, you have right to legal counsel, which you have it, so I don't have to go that far. You don't voluntary waiver, you have your legal counsel. So from here, I'm going to go ahead and turn this on over to Mr. Bustamante, so you can state your case, please.
Good morning, honorable stewards. Good morning to everybody, and thank you for the opportunity here. As the stewards well know, we are here today pursuant to Rule 15.2.1.9 3C. The hearing to determine whether Mr. Taylor's summary suspension should continue pending a final disciplinary hearing and ruling. And honorable stewards, the commission respectfully submits that based on the evidence and testimony you'll hear today, that there is a sufficient basis on which for the stewards to continue the summary suspension. And the commission would start with the testimony of Dr. Angela Pelzel-McCluskey. Doctor, I remind you, you're under oath, and if you could please state your name for the record and how you're employed and where.
Yes, sir. I'm Dr. Angela Pelzel-McCluskey. I'm the National Equine Epidemiologist for USDA APHIS Veterinary Services. That's the Federal Animal Health Regulatory Authority in the United States. I am physically located in Fort Collins, Colorado as my duty station.
All right. And doctor, if you could specify for the stewards exactly how it is you're involved in this, in an investigation involving Mr. M. Heath Taylor.
Yes, sir. So my job for USDA is to oversee the national level and interstate response for any equine regulated disease, either state or federal. So daily, I am working with state animal health officials, state veterinarians' offices, and my local federal personnel in each state to respond to cases of equine regulated diseases, equine infectious anemia being one of those.
All right. Okay. And how long has your investigation been going on involving Mr. Taylor?
This investigation began in mid-September when we first got notification that we had a presumptive positive EIA test on a horse under the care of Mr. Taylor. And that test was positive at an approved laboratory, a local laboratory in California.
All right. And, briefly, doctor, because I am going to be eliciting some testimony from Dr. Veterinarian Brandy O'Sullivan on EIA. But briefly, could you just explain exactly what EIA is?
Yes, sir. EIA is an infectious virus of horses. It can infect horses, donkeys, mules, and other equids such as zebra. It is an incurable, intreatable virus. It is very similar to HIV virus in humans. It's a retrovirus, which is why it's so difficult to treat or manage. EIA is spread by biting flies in the natural transmission sense or by any form of blood-borne transmission through human causes, such as needles or syringes.
Doctor, I call your attention to a series of spreadsheets dated the beginning October 2nd, 2024 through October 17th, 2024. Can you explain to the stewards what is the significance of those spreadsheets and what do they inform as they progress in terms of chronological order?
Yes, sir. So as an epidemiologist, I created those spreadsheets. I went into Equibase and other sources and identified horses that fit the clinical picture and the potential exposure timeline of EIA horses involved with Mr. Taylor. And so those are epidemiologically linked horses to the positive EIA positive horses that we identified. And the significance of those spreadsheets is that it shows over time how quickly we began to identify more and more positives from the exposed list of horses that were under the care of Mr. Taylor sometime this summer.
Doctor, currently as we are here today, please explain to the stewards what is the total number of horses under the care, custody, control of trainer Heath Taylor that have been identified as being positive for EIA?
So to date, we've identified and confirmed positive at our National Veterinary Services Laboratory in Ames, Iowa, 23 horses that are infected with EIA associated with Mr. Taylor.
All right. Out of that 23, can explain to the stewards, please, the current status of those horses in terms of their condition, after the diagnosis?
Yeah, so their disposition currently, we have already euthanized 20 of the 23 horses. There is one more horse infected that's going to be euthanized by the Texas Animal Health Commission today. One horse died from the disease itself, and one horse remains quarantined in New Mexico, awaiting a disposition decision by the owner.
Doctor, if you know, regarding, in addition to those 23 horses, are there any other horses associated with Mr. Taylor as trainer that the USDA is concerned about or monitoring or quarantining?
There are. We have two groups of horses that are currently under regulatory investigation. From that list of spreadsheets, we had 53 total horses that we considered to be potentially directly exposed, so a primary exposure that would have occurred sometime under Mr. Taylor's care while the horses were racing together in New Mexico this summer. And then there's an additional 72 or slightly more horses. I don't have a full count, but at least 72 horses that were considered to be secondarily exposed, meaning they were found in the vicinity or in the same care or geographic location in close proximity to positives when they were found, and therefore were a secondary exposure. So those 72 additional secondary exposures are also under quarantine or hold order in at least 3 states.
And just so I understand you correctly, Doctor, that 72 or 73 horses, are those also horses that are under the care, custody, control of Mr. Taylor because he's their trainer?
No, sir. Those horses are all under many different ownerships and trainerships at this time. Again, in those 3 states, California, New Mexico, and Texas. Those were horses that, when the positive horses, some of them left Mr. Taylor's care and went to other locations, that secondary exposure occurred in the hands of other people and other facilities.
Okay, but just to clarify, all total, between the deceased horses, the horse that died, and the horses that the USDA is monitoring or quarantining that are directly under the control of Mr. Taylor as trainer, what is the total number, if you know, Doctor?
I don't think I can put a number on that, Mr. Bustamante. I've got at least 30 horses that were pulled out that were under Mr. Taylor's care in California. And I've got another 30 where only a portion of those in Texas were under Mr. Taylor's care. They were in the same barn with several other trainers. So I don't have a total number on you, but I've got the 53 directly exposed that were under Mr. Taylor's care, and then at least 30 or more of the secondarily exposed.
Right. Doctor, with respect to the 23 horses that you testified earlier had either been euthanized or one that died, how does that relate to the total number of EIA cases nationwide that have so far been identified this year?
Yeah, so this calendar year beginning in January, so 2024 calendar year, we've conducted over 960,000 EIA tests in the US as of around September. So that number is actually higher, probably closer to 1 million now tests nationwide. And out of those tests, we've found to date 111 EIA positive horses across the US in multiple states. Out of those 111 horses that were positive this year, 23 of those were connected to Mr. Taylor's care. So that's slightly greater than 20% of the total national cases are associated with Mr. Taylor right now.
Thank you, Doctor. Doctor, you testified earlier about how EIA can be transmitted. Can it be transmitted by touch?
No, sir.
Okay. And why is that the case, that touch is not a transmission method?
Sure. So similar to HIV, this is a blood-borne disease. So the virus is actually circulating in the blood, which means you have to remove blood from an infected horse and put it into another horse either by injection or by fly bite transmission by the types of flies that are blood feeders. And we only have a short list of flies that are actually capable, fly species that are capable of doing that level of blood feeding to transmit EIA virus. But you must physically move blood from one infected horse to another horse to transmit.
All right, thank you, Doctor. Doctor, if you know, why would a person inject blood into another? I'm assuming it's blood from one horse to another horse. Am I correct there?
You are correct.
Okay.
So we have, that's called
I
iatrogenic.
I know that the rules of evidence don't necessarily apply here, but I'm going to object to that question as not even being appropriate when the rules of evidence don't apply. Pure conjecture, wild conjecture, totally inappropriate here as to why is just way too broad of a question.
Dr. Fontenot, you're muted.
Billy Blackburn, for the purposes of the record, we didn't hear half of what she said because there was an announcement over the loudspeakers here that basically wiped out all of her testimony about this, what she just talked about that Mr. Lindenberger objected to. Mr. Cruz.
Restate your question again to her so Mr. Blackburn could hear that.
All right. Doctor, repeating my question is, why, if you know in your work and research, would anybody transfer blood from one horse to another horse?
Sometimes it occurs by accidental means through reuse of needles and syringes, but other times blood or plasma products are physically injected from one horse to another to increase athletic performance.
And Doctor,
again, I'm going to object on wild speculation, totally inappropriate here, regardless of whether or not the rules of evidence apply. Absolutely no foundation for that. We have no information as to her background in racing, where any of this information came from. That's just completely inappropriate in this setting.
I'm gonna let the answer stand because she is stating her professional and she's a witness and everything. She's just stating how it can be transferred by either by insect or by, as you could say, contaminated tools. I guess you could say that, medical tools. So we're gonna let that answer stand.
thank you, Stuart
Okay,
Fontenot.
Rick, go on.
All right, Doctor, in your investigation of Mr. Taylor's horses, have you had dealings or communications with Mr. Taylor?
I had communications with Mr. Taylor more than a week ago to answer some of his questions about the status of his horses in California and whether or not they would be racing there under California Department of Food and Ag quarantine. I also spoke to him about the potential for how these horses might have been infected. And at that time, he provided me information regarding his veterinarian and treatments those horses were given.
And what did Mr. Taylor specifically tell you about the veterinarian?
Mr. Taylor identified to me his veterinarian and the veterinary practice, and also gave me information that that veterinarian and some associates came out to Albuquerque and treated horses for him on July 29th, July 30th, and 31st. And specifically, the horses that were since confirmed positive were all horses that were treated during those 3 days by his veterinarian.
Anything additional that Mr. Taylor shared with you or advised you regarding the USDA investigation and his horses?
He asked me, or he provided me information to the best of his knowledge about the types of things and what was administered to all of the horses by his veterinarian at that time. And he did request that I investigate that as a possible source, which we are working on.
And so do I understand correctly that the USDA investigation is ongoing?
It is ongoing. Yes, sir. We have not identified yet the source of the virus, but we have identified the transmission route.
And please provide the stewards with your information regarding what the USDA has determined is the source of the transmission and how you arrived at that conclusion.
Sure. So again, the source has not been determined, but the transmission route has been confirmed as iatrogenic transmission. That is human-caused transmission through bloodborne means, either through medical equipment or through administration of substances contaminated with EIA virus and blood-laden virus. We arrived at that conclusion based on our data and information historically from natural fly-bite transmission herds, which usually take a period of multiple years to up to a decade or more to transmit by natural fly-bite transmission in an endemic herd over time. And flies are not a very efficient source of transmission from horse to horse very quickly. Rather, to infect 20 horses or more in an endemic herd, our data shows that that takes many, many years of the horses being together and in that environment with the flies. So it's not physically possible for fly-bite transmission and natural transmission to have been the cause of spread in Mr. Taylor's horses. Given the very short timeline, we have a tight window when we had horses with negative testing conducted in August. Specifically, the horse Bullet Train had a negative test that was drawn August 12th in New Mexico. We did obtain that sample and tested it, confirmed negative at NBSL, and our fraudulent blood testing confirmed that that was blood directly from Bullet Train by DNA analysis. So he was either incubating the disease on August 12th or had not yet been exposed or infected.
Doctor, thank you. Stuart Fontenot, at this time, no further questions for the doctor. Thank you very much, doctor. And again, respectfully, I remind everybody that the doctor does have a 9 o'clock obligation.
All right. Thank you. Who would want to go first? Mr. Wimberg?
Yeah, let him go first.
Mr. Wimberg, go ahead and put your questioning.
All right. Well, I'll do my best, but this hearing was scheduled for 8 o'clock. It is your witness, and it is only under due process. I think we are required an opportunity to question her. So if that doesn't occur within the next 20 minutes, I suppose that we will be asking for a default ruling in our favor and or to strike her entire testimony. Now, Doctor, you mentioned that biting flies can be a natural source of this. Where in New Mexico are some of those blood-sucking? Well, let me start with this. Are stable flies some of the blood-feeding flies that you mentioned?
The Stomoxys species of stable flies, yes, they are one of the transmitters of EIA virus.
And where in New Mexico are those located?
Those are located throughout New Mexico. They've been identified in multiple places.
They're located in Ruidoso, correct?
They are.
Is there anything associated with horse racing in Ruidoso?
There is.
What would that be?
There's a racetrack there.
And do you know when that racetrack runs?
I'm not familiar with track run times, but I do know that Ruidoso attempted to run this summer for a period of time before they had physical limitations by natural disasters.
And in fact, on the spreadsheets you made, every single one of these horses was at the track in Ruidoso this summer when they were attempting to run, correct?
Correct.
And what investigation have you done as to the circumstances at Ruidoso this summer?
Yeah.
We've done a great deal of testing in horses that were also present at Ruidoso, and to date, the only positive horses that we found present at Ruidoso during the same timeline as Mr. Taylor's horses, none of those other horses have tested positive for EIA.
How many horses have you tested that were at Ruidoso that are not associated with Mr. Taylor?
So far I don't have a count of that because the testing was required by the Racing Commission for their track sites. So all of that testing is occurring outside of what I can see. But a great deal of horses in New Mexico, including horses that were at Ruidoso, are in the process of being tested the last few weeks.
Okay, well, what is a great number? I'm sorry.
But
5, 10, 15, 20?
Several hundred horses are being tested in New Mexico right now.
Okay, and you said that you used the term "we" when you mentioned testing, but now it does not sound like the USDA is actually doing the testing. Who is doing the testing?
We have 400 approved USDA approved EIA labs in the United States, and those labs are authorized to do testing of samples submitted by accredited veterinarians.
And how did you verify which horses had been at Ruidoso this summer?
I used Equibase data and their racing and workout official works from Equibase.
And so each of those several hundred horses that you mentioned that you don't have a number for, each of those you went back through the Equibase and verified that they had run at Ruidoso this summer. Is that correct?
I did not. The Racing Commission and New Mexico Livestock Board and private practitioners in New Mexico are overseeing the testing of those horses. Any non-negatives that we identify are required to be reported to USDA, and the samples are forwarded to my laboratory at the National Veterinary Services Lab for follow-up testing and confirmation. So the fact that we've had no other non-negatives presented in all of the testing that's currently going on in New Mexico is what I'm basing that response on.
And how long is the race meet in Ruidoso?
I don't know. I'm not a racing official.
And would it surprise you if it ran from May to September?
No.
How many of those, let me ask you this, what percentage of those horses that you mentioned that you don't have a number for that are being tested were in Ruidoso for racing in, let's say, the middle of June?
I don't know. That's not data that I have looked up. Again, I'm a disease responder, so I respond to presumptive or confirmed cases of the disease.
Well, you did mention that you're investigating the source of this. Is that correct?
I am.
But you're investigating the source, but you're solely relying on information that you're being provided from other people. Is that correct?
Not necessarily. I'm gathering data and information from others, but I'm not sure I fully understand the question. What type of information are you asking about?
I'll move on. Black flies. There's blood-sucking black flies as well. Is that correct?
Black flies are not a species that is known to be able to transmit EIA virus. Black flies do transmit other diseases.
Okay. So they're blood feeding. Is that correct?
Yes, but they don't have the right mouth parts to be able to capably transmit EIA virus from one horse to another.
What mouth parts do they need?
They need both hacking, slashing mouth parts to open a large wound when they feed, and they also need spongy parts to their mouth parts to hold a great deal of blood, which contains the virus, so in enough volume that it can transmit to another horse with a subsequent feeding.
But stable flies have those parts?
They do, yes.
And they are present in the Farmington area, is that correct?
Sure.
The Ruidoso area?
Sure.
Albuquerque?
Sure.
Hobbs?
Sure.
El Paso area?
Yes.
Just to well, let me ask you about these spreadsheets a little bit. You indicated one of these columns is about exposure, but when you're talking about exposure on these spreadsheets, really you just mean that Heath Taylor trained them at some point this year. Is that correct?
No, Mr. Taylor trained hundreds of horses that I have not gone out to specifically identify for testing.
Okay, well, what was different about the ones that you included on the spreadsheets?
Those horses on the spreadsheet were present with him and his training staff in New Mexico, racing and training together for the summer. specifically during the tight timeline in which we know that infection was transmitted based on the clinical picture of the horses as they succumbed to the disease, and also the earlier testing results that we had from mid-August and prior. I also included an additional set of horses that raced earlier in the year because I wasn't yet sure whether one of those horses could have been an earlier source of the infection to the others in his training string.
You mentioned mid-August and prior. What other prior tests did you have?
So we had testing from several horses that had a Coggins test run prior to August, and I don't have that data in front of me, but the timeline based on Bullet Train, the index horse, was the key piece of information that tightened the timeline on when these horses would have become exposed together and infected.
And so what is that timeline?
So Bullet Train had a negative EIA test run at the New Mexico Veterinary Diagnostic Laboratory from blood drawn by an accredited veterinarian on August 12th. And again, we confirmed at NVSL that that blood sample was indeed from Bullet Train and was indeed EIA negative at that time.
And so what is the time frame of exposure then?
The time frame of exposure would have been either shortly before that or any time after that, prior to when the horses arrived in California sick in early September.
What is shortly? You say shortly, but give me a time frame. What does that mean?
Within a few weeks.
A few weeks. Is that because the incubation period for this disease is only a few weeks?
The incubation for this disease is usually around 45 days, up to 45 days, but we have evidence to show that incubation times vary widely on individual horse immune systems. And we have a 60-day required rebleed period post-exposure by USDA because the incubation period can go much longer depending on the virus source and the horse's immune system.
So we'll start with the 45 days. What was this 45 days before August 13th?
I don't have a calendar. I don't have a calendar in front of me, but I did include horses on the primary exposed list all the way back into June, you'll see.
Okay, and so you also mentioned you have a 60-day requirement. So 60 days before August 13th would encompass about 2/3 of the month of June. Is that correct?
I think that's correct, but I do have horses on the exposed list that have been tested negative, that we confirmed negative from that time period.
What is the United States Coordinated Framework for Biotechnology?
Not sure I'm the right person to answer that question. I don't understand that question.
Are you aware that your organization, the USDA, is partners with the EPA and the FDA within the U.S. Coordinated Framework for Biotechnology?
I work for a very small branch of USDA APHIS, the Animal and Plant Health Inspection Service, Veterinary Services, which is a tiny program that does not coordinate currently with EPA or other entities for what you're describing.
Would it surprise you if the USDA, through that coordinated effort, published information, your organization, that indicated that the incubation period for EIA can last longer than 60 days?
That is not a surprise. We know it can last longer than 60 days. I have that data.
And it wouldn't necessarily be all that uncommon for an incubation period to potentially last as much as 3 months. Is that correct?
That would be actually rather uncommon. In fact, I find that in rare cases. I've only had 3 cases in the last 15 years where the incubation period was more than 60 days. In those cases, it was 120 days. And in one case, it was 180 days. But that's out of over 1,000 EIA cases in the last 15 years. So I would call that uncommon or rare.
And how do you identify the source of infection when you learn of an infection? How do you differentiate between, well, let me ask you this. How do you differentiate in your work between, for instance, infection through tainted medical equipment versus naturally occurring through, for instance, a stable fly?
Yeah, so we use a lot of different tools in our toolbox. Mainly, we do a lot of discussion with owners, trainers, and veterinarians about how the horses have been handled in the time period in which infection may have occurred. And we list out and find potential common sources among the positive horses. When those sources are identified as iatrogenic transmitters, we do try to go further. And usually the trace back and the testing of other horses that were potentially exposed by that route will prove or disprove whether iatrogenic transmission has occurred, as it did in this case.
Um, let me ask you this. You mentioned this, but what occurred in Ruidoso this summer that disrupted the race meet?
My understanding is that they had an extreme fire followed by flood event, which washed out the track.
And how did that flood event affect the barns and stables where the horses that were there to run were kept?
I don't have that information. I was not present.
You're not looking into that in part of your investigation as to the potential source of this?
We tested horses that have left that facility. And again, the only positives that we're finding belong to Mr. Taylor. So if there was a natural transmission event at Ruidoso, I don't find that flies typically choose only one trainer's horses to spread disease to. They usually are indiscriminate in multiple trainers' horses being infected if it's a fly bite choice.
Well, I'm sorry. I thought earlier you had testified that it can take years for an entire herd to be spread by flies, but now it sounds like you're saying that one fly will just hop around the barn and suddenly you could have 5, 6, 7, 10.
We have not found that. We have not found that to occur in a racing environment. No, these flies typically like a pasture situation for long-term transmission. And that's how we get endemic herds and more effective transmission, but it does take years to do that. You asked me if I investigated that, and I did.
And so you say you don't find it in a race situation. Do you find individual horses infected in a racing situation through flies?
Not through fly transmission at the track. Rather, I find individual positives that might be standing at a track. And through traceback investigation, we find that the source of their infection was obtained elsewhere, usually in a pasture situation if it's natural transmission, or by iatrogenic means if it's not a natural transmission.
So a pasture
Martin,
situation.
excuse me 1 second. Excuse me 1 second. My thing just kicked off. Let me restart the recording again. I got the backup one. Some reason it just kicked back off and. Okay, we're good to go. It kicked back on.
So you mentioned a pasture situation. Is there any pasture situation that you're aware of in the Ruidoso area?
In general, there are pastures in Ruidoso, yes.
And do those pastures have horses?
I would assume that they do.
Where in New Mexico are there wild horse herds?
So there are BLM lands and Forest Service lands with feral or wild horses in New Mexico.
And where in New Mexico?
I don't know. That's not my program.
Are you aware that there are multiple wild horse herds in the Ruidoso area and in the immediately surrounding mountains?
No, I know that we have BLM horses in New Mexico because a member of my team runs that program.
Have any of those horses from the wild herds in and around Ruidoso been tested?
Yes, actually, when my associate gathers those horses from the range, they are all EIA tested before they're placed in quarantine facilities and adopted out.
And when was that when did that occur? In the last 4 months?
I'm not aware of any gathers occurring in New Mexico in the last 4 months of BLM horses.
What about the last 6 months?
I'm not aware of any.
Are you aware of when the last one occurred and where it would have been in New Mexico?
It would have been, I really don't know. Again, it's not my program.
Um, are you aware that when did the flooding occur? When did the flood event occur, as you called it, in at the Ruidoso Downs racetrack?
I don't know the exact date. I know it was sometime during the All-American trials, I thought, because that had to be stopped.
And you mentioned the All-American trials. When are those run?
My understanding is sometime in August. Again, I'm not a racing official with known racing dates in my purview.
Would it surprise you that the trials were run significantly earlier than August?
No,
Do you know when the trials for the Rainbow are held in Ruidoso?
I believe they're before the All-American trials, but I do not know the dates.
And are you aware that there was a period following the flood event when the barns were completely flooded and the horses that were housed there in Ruidoso were within standing water, deep standing water for a period of time? Are you aware of that?
I was told by a New Mexico Racing Commission official that the horses were no more than ankle deep in water, but again, I did not witness that personally.
Ankle deep in water, that's still standing water, correct?
I would call that standing water, yes.
And one of the places that you find EIA transmission is in wet, swampy areas. Is that correct?
Historically, it used to be, but that's not true anymore.
So wet, swampy areas, you say historically because naturally it occurs more there. Is that correct?
The flies that occurred in the Gulf Coast states and the Gulf Coast region several decades ago were the primary reason for the transmission, but the reason for the flies being there wasn't necessarily the swampy conditions.
The water that these horses were standing in, where did it come from?
I don't know.
Do you know where the fires were around Ruidoso?
As a native of Colorado and Texas, I have never lived in New Mexico, so no, I did not follow that very closely.
Now, you indicated that there were 111 total EIA positives this year. Where were the rest of those located?
I have at least 12 or 13 different states. I would have to pull my list up to review that.
And give me a region. What region are they primarily in?
These are across the country. All regions are represented by the EIA count this year.
And are they wild or domestic horses?
These are domestic horses.
Are they race horses or pasture horses?
Predominantly, we have a lot of race horses.
And the race horses, are there, am I correct in understanding that this is the only situation where there were, say, 20 of them together, where there were multiples together? Is that correct?
We have a few small clusters of racehorse affected herds, but not to the tune of 23 infected horses. They would have been smaller clusters of 15 or less.
And so is that the cutoff for you for a small cluster, 15?
No, I'm just trying to describe for you without pulling up the data and giving it to you.
And of those other racehorses, what was the determination that the USDA made as to the source?
Most of those cases were iatrogenic transmission, usually with involvement in bush track racing, but some of the quarter horse racehorses were both sanctioned and bush track horses that were smuggled from Mexico, and transmission in Mexico by unknown means was the source of their infection.
Now you said most. What was the source for the others?
That we have a very small number of horses that had natural fly-bite transmission in endemic herds.
And how did you determine that it was a natural fly-bite transmission for those horses?
We investigated all possible sources of their handling and investigations of their ownership over the years, where they were stabled and how they were stabled. And those small number of natural transmission situations were older horses that had been with other positive horses that had been untested or under-tested over the years.
And so, well, correct me if I'm wrong, you don't ever actually know if a horse receives it from naturally or otherwise. Is that correct?
That's not correct. In fact, we have many owners and trainers that after we question them and identify their methods of handling and what substances or what methodology they're using to handle horses and inject materials, we frequently are able to confirm that 4 main pathways for iatrogenic transmission are quite common. Reuse of needles, syringes, and IV sets is something that we often determine through investigation with the owners and trainers involved. Reuse of double dipping into multi-dose blood vials or multi-dose drug vials where we get blood contamination is another common source. We do have owners and trainers that admit to using blood and plasma products from Mexico or from other horses in the barn that are infected. And those are some really common things that we are able to determine through the investigation and discussion, interviewing of the owners and trainers and their practices.
So you mentioned, for instance, reuse of IV sets. Obviously, there has to be a horse somewhere within there that was already infected. Is that correct?
That's correct. There is a source somewhere.
And so how do you determine how that horse, whether that horse was infected naturally or otherwise?
We do trace back for every positive, and again, with interviewing the owners, trainers, veterinarians, obtaining medical records, getting information on how the horses are handled and what they receive, we first rule out the iatrogenic transmission and find other herd mates that are positive in a pasture situation in order to confirm a potential fly-bite transmission.
And so I'm assuming that's been done in this case. You've obtained medical records, is that correct?
I have requested medical records. I have not received them.
Okay, and which records did you request?
I requested the medical records that Mr. Taylor directed me to, which were the records from his veterinarian at ESMS, the Equine Sports Medicine Services Group, from the dates that he says the horses were seen by that group on July 29th, July 30th, and 31st.
And when did you make that request?
I made that request through the Texas Animal Health Commission, which is my state animal health partner. And I don't know that they have yet been able to sit down with the veterinarian and get that information.
I'm sorry, my question was, when did you make that request?
I made that request on Friday last week.
On Friday of last week. And when were you asked to provide testimony today?
Gosh, sometime middle of last week. I don't recall.
So you were asked to testify before you had even made a request for the medical records, which you say you used to rule out natural transmission. Is that correct?
I haven't used the medical records to rule out natural transmission. You were speaking in general about epidemiology of how I investigate EIA cases. Again, this investigation of the source of infection for these horses is still ongoing.
And so the source very well could be natural. Is that correct?
No, it cannot.
Let
Statistically,
me
it
ask you
cannot.
this. Is it feasible that one horse received it naturally and the rest got it through some of the methods that you're talking about? For instance, reuse of IV?
That is possible, yes.
And how common is reuse of IV at the racetrack? Do you know?
I do not know at the racetrack. I know that is very common in the cases of EIA infection that I investigate.
And are you familiar at all with standards of practice for equine veterinarians when it comes to IVs?
I am. I've been an equine veterinarian for 23 years.
Have you ever reused an IV?
I have never reused an IV set between horses without having it fully sterilized.
And how many times have you treated multiple horses in one sitting?
Over my 23-year career, hundreds.
And how many times have you provided IV to, let's say, 10 horses in one day?
Probably 100 or so times.
And does this always occur in your offices?
No, I was on field service as well in my truck.
And so you had, how many IV lines and such do you keep in your truck?
I usually keep a full box of at least 50.
50. And so you go out, you treat one horse, and then you completely sterilize that. You get everything ready again. You go and find the next horse, and you do that all day long. Is that correct?
No, so I use unreusable boxes of IV administration sets, one per horse, and I throw them away afterwards.
Okay, what's included in an IV administration set?
An IV administration set is just the line itself, and then I use individual needles and syringes and catheters to administer IV fluids.
And uh, just curious, who provides the who provides the lines? Is that the U.S. government for you?
So my work for the US government is not in treating horses. I'm an epidemiologist. My work as a private practitioner is off hours from USDA and in private service, private veterinary service. So those are purchased by the practice that I run.
Do you treat racehorses at all?
Not anymore, no.
When was the last time you treated racehorses?
Probably 10 years ago.
What kind of horses did you treat?
I treated
Thoroughbred?
quarter horses, yes, sir.
So you treated quarter horses, yet you have no idea the race meet in Ruidoso. Is that correct?
Correct. I was practicing in Texas and Colorado where I hold licenses. I've never been licensed in the state of New Mexico, nor have I ever worked veterinary-wise on horses in the state of New Mexico.
So is it fair to say you have no idea what the standard of practices are for veterinarians in New Mexico?
The standard of practice for veterinarians across the United States is dictated through our veterinary teaching schools. So I do know the standard of minimum care for biosecurity and hygienic practices as an equine veterinarian across the country. There is a minimum standard of care.
And who publishes that?
The American Association of Equine Practitioners publishes the standard of care for equine practitioners in the United States.
And are horse trainers members of the AAP?
They are not.
What other animals can carry AIE?
I'm sorry, can you repeat the question?
What other animals can be carriers of EIA?
Only equids are capable of carrying EIA virus.
Um, Give me some other equids. Would, for instance, say donkeys?
Yeah, so I said at the beginning of my testimony that it's a disease of horses, donkeys, mules, and potentially zebras, which are all equid species.
And have you done any testing of mules or donkeys in your investigation?
I have not encountered any exposed mules and donkeys in this investigation, but we have tested hundreds of mules and donkeys across the United States for EIA this year.
Have you tested any in this investigation?
Not to date.
Have you inquired about the presence of any mules or donkeys in this investigation?
Yes, on every premises that we encounter that has an exposed or a group of cohorts, we document the type of equid present, and all of those cohorts are tested, whether they are donkeys, mules, or horses. To date, there have been no donkeys and mules on the cohort premises that we've found.
And how do you define that premises? For instance, are you limiting it to an individual barn? Are you limiting it to the entire backside of the racetrack? If so, which racetrack or which racetracks? How far of a net do you cast?
So that's usually determined by the state animal health official in each state where the work is being done. In some cases, we've done entire barns that are associated with exposed horses. And in other cases, we've identified specific owners and trainers and management that were the potential for the exposure and limited the testing to those. So usually we do not test an entire backside. We did go out with some information to horsemen that exposures had occurred and tests were recommended, which is the reason why there's so much testing in that population going on right now in New Mexico.
For instance, you didn't go around and you have let me ask it this way. Do you have any idea if there are mules or donkeys in close proximity to either the track in Albuquerque or the track in Ruidoso?
I'm not aware of that information. I don't know.
Do you have any idea if there is a wild mule herd to accompany the wild horse herds outside of Ruidoso?
Not that I'm aware of, but I don't have that information.
And so you say you have a 60-day quarantine period, is that correct?
We have a 60-day post-exposure rebleed requirement, and quarantines by the state animal health officials are employed to carry out that post-exposure test requirement.
And when was the last positive test in this investigation?
I would have to look that up, but Mr. Ivory was confirmed positive on either Friday last week or Monday this week.
And where is Mr. Ivory located?
Mr. Ivory is currently in Texas. He's the horse being euthanized today.
And had Mr. Ivory been at Ruidoso and at Albuquerque Downs?
I don't know his particular status. I'd have to look at my notes. I apologize. He would have been at either one or both.
Any other positives outside of the beginning or outside of September and the very first part of this month?
What do you mean, when they were diagnosed or when they were potentially exposed?
Positives, a positive.
The test the first confirmed positive test was September 20th. That was confirmed by NVSL on September 20th. The horse was presumptive positive a week prior to that in California.
Who instigated that test?
That test was done, to my knowledge, by the attending veterinarian at Los Alamitos in California because the horses arrived sick.
I'm sorry, who was it that directed that test occur?
The private practitioner, the very first index case was identified by the private practitioner. She decided to test the horses.
And who was directing the private practitioner to make that happen?
No one. She was looking at clinically sick horses in which she suspected EIA infection as the cause of their illness. So it was her choice to conduct a test for both EIA and pyroplasmosis to rule in or out that clinical picture that she was looking at.
What's her name?
I apologize for the interruption, but doctor, I know you had a 9 o'clock. Are you okay to continue, or should we perhaps talk to the stewards about continuing this hearing? And I apologize, Mr. Lindenberger, for the interruption.
I can continue a little bit longer, Richard.
Richard, just so that you know, I don't think you can continue this. You have sidelined Mr. Taylor. You have ceased his ability to make a living, and it would be in violation of both the regs, the rules, the statute, and due process to continue this matter because you are not prepared to proceed in a timely fashion with the appropriate witnesses. Just want to put that on the record. And so if she is unable to continue, we will be seeking that her entire testimony be stricken. What is the name of the veterinarian that you were just referring to?
I don't know her name. That test was overseen and the follow-up testing was overseen by the California Department of Food and Agriculture, who are my colleagues at the state level.
Well, you were just providing pretty specific testimony of how that occurred, and yet you don't know the name of the person?
I've never met her, so no. I work with hundreds of veterinarians, none of which I know personally in my capacity with USDA.
And yet you have very specific information as to how she acted, what she did, why she did it, yet you have never met her, you have never spoken to her, you don't know her name. Is that correct?
That's correct, because the actions she took were part of my epidemiological investigation about how the first case was identified.
And in part of your investigation, you didn't think it was appropriate or necessary to speak to the veterinarian that purportedly originally identified this?
That task was delegated to the California Department of Food and Agriculture, who are my state animal health official colleagues and are the appropriate person to interact with their local veterinarians.
And who was that?
That is Dr. Josh Kloppel at CDFA.
Is he here today?
He is not.
And when did he speak with this unnamed veterinarian?
My understanding is he first spoke with her when the positive test was issued by Antech, which is the approved laboratory in California. So the presumptive positive was reported by Antech to Josh Kloppel at CDFA and to us at USDA, and the sample was forwarded at that time. So that would have been sometime within the week prior to our confirmation of the test on September 20th.
Do you know how he spoke with her? Telephone, in person, Zoom, anything like that?
He worked with her both by telephone and in person. He's been working with her to date.
And what reports has Josh provided you? Let me ask it this way. Has he provided you with written reports?
By email, yes.
How many emails?
Several dozen to date.
Any formal written reports?
No, he's a field veterinarian.
And have you provided those emails to anybody associated with the New Mexico Racing Commission?
No.
Is there a reason that you haven't provided those reports to anybody associated with the New Mexico Racing Commission?
Usually I keep my work between each state animal health official, federal animal health officials in that state, and racing officials in that state among that group, except when we have multi-state information to share, such as a trace back or the movement of a horse interstate that needs to be chased down in a different state. So their information and our response stays in the state to state level. And until or unless we have information that needs to be shared across states for follow-up.
So is it your testimony that this situation is not one in which there needs to be sharing of information between states?
We have shared information between states, such as the exhibit that was presented, the list of exposed horses that was being traced down.
But you made the independent determination that nobody in New Mexico needs to have any idea what Dr. Josh is doing or what he has found. Is that your testimony?
No, I have shared information with state animal health officials in other states when it impacted their investigation.
All right, well,
But
what
I don't send emails from another state to another state that don't have any relevance to the receiving state.
What information from Dr. Josh did you share with the stewards prior to today?
I don't have direct contact with the stewards. I have contact with the New Mexico Racing Commission through Izzy Trejo.
Well, what information did you share with Izzy?
The spreadsheets that were part of the exhibit.
Is that the whole total of the information you shared with Izzy is the spreadsheets?
I believe I provided information when we had a blood sample that was at New Mexico State Veterinary Diagnostic Lab from Bullet Train. That information was shared because we needed to investigate and look at that previous blood sample.
Did you provide background information on your investigation at all?
I believe I did. It would have been in the email that connected to the spreadsheet.
And when was that email sent to Izzy?
It would have been on October 2nd.
I'm sorry, one of these spreadsheets says handwritten date on it, October 2nd. The rest of them have handwritten dates after October 2nd. So were these all shared on October 2nd?
No, each spreadsheet was updated on the date, and I believe that handwritten was through Mr. Bustamante's office to orient people on when those were received, the dates those were received. But each date corresponds to an email that Mr. Trejo would have received that same email and that updated spreadsheet on.
Okay. Did you have any direct communications with Mr. Bustamante or just Mr. Trejo?
I have spoken previously to Mr. Bustamante, yes, in the course of this investigation.
And when did you speak with Mr. Bustamante?
Mr. Bustamante and Izzy and I spoke when they were evaluating what they wanted to do for an EIA, an update of their EIA entry requirements. So we spoke on the telephone about recommendations for how that new requirement should be written or what it should contain. And then I spoke with Mr. Bustamante at least twice regarding the information that I was to present today.
Well, let's start with the entry requirements. What day was that you had that discussion with them?
I don't recall.
Give me a ballpark. A week ago, 2 weeks ago?
It was several weeks ago. It would have been shortly before they issued the new updated EIA entry requirement for New Mexico racetracks.
And then when was the first time that you spoke with Mr. Bustamante alone?
That would have been relative to my testimony, probably. Was that Monday this week? I apologize, I don't recall. It was within the past week.
Okay. And did you ever have a discussion with Mr. Trejo or Mr. Bustamante as to the findings of the USDA to date?
In discussion of my testimony and information to be presented, yes.
And so when that discussion occurred, was there already a hearing set?
I believe there was, yes.
And how are these findings documented?
The findings are documented in my internal epidemiologic reports for USDA.
And when was that report finalized?
So there have been multiple reports. I usually do a weekly situation report for my superiors.
So the findings that you testified to earlier, which report were those in?
Which findings do you mean?
Well, you had testified earlier that you had made a determination, although I believe you termed it the USDA had made a finding as to transmission, but not source.
That's correct. So that was first determined in, I believe, the first or second week in October.
And did you give any of those reports to anybody associated with the New Mexico Racing Commission?
No, those are internal USDA reports. I did produce a public report which went out to the Equine Disease Communication Center, which contains summary information on this case.
And when was that released?
We'd have to go back and look at the postings for when the Equine Disease Communication Center posted that information.
Well, when did you send it to them?
I would have to look at my notes. I don't have that in front of me. I apologize.
Give me
It would have been shortly after the determination was made in early October that the transmission pathway was iatrogenic transmission, although the source has not yet been determined.
And what else is included in your internal reports?
It's a listing of the positive cases, the listing of exposed horses that have been identified, tested, what their test results were, a list of horses that have not yet been located for testing, the locations of where those horses are located in which states. That's the majority of what's in the epidemiological report, in addition to discussion of the investigation of pathways and source traceback information.
So when you say a discussion of the investigation, does that include, for instance, if you receive statements from somebody, that would be included in the report?
Not necessarily. This is summary information for senior executive service members of the federal government. They don't read a lot of detail, so you have to be kind of summary.
So you're summarizing what people told you in the investigation. Is that correct?
We are summarizing what the investigation is yielding from interviews, yes.
And those are written down in reports by you, signed by you as correct. Is that correct?
Yes.
And how is it that we obtain copies of your written and validated reports?
You would have to do a FOIA request for the federal government, which is a normal process I'm sure you're aware of.
And those are available through FOIA.
All federal information that is FOIAble is available through FOIA.
Are those reports available through FOIA?
The FOIA office would have to determine that, but I would assume yes.
Has anybody associated with the New Mexico Racing Commission requested those reports from you?
No.
Does anybody from the New Mexico Racing Commission before today know those reports existed?
I don't know.
Did you ever have discussions with anybody at the New Mexico Racing Commission about those reports?
No, it's an internal process.
What is your understanding from Mr. Bustamante as to what you were supposed to testify to today?
Mr. Bustamante was specifically going to ask about the origin of the exposed horse spreadsheet, which I created, and the investigation of the virus transmission and source that we had to date, although that was less important than the progression of disease in the horses.
Why do you say it was less important?
Because my understanding is this is a hearing that is not needing the detail that you're currently asking me, but
So it's your understanding that for purposes of this hearing, the source and transmission of were not as important as the fact that there were a bunch of horses. Is that correct?
the risk to equine health and the industry is more important for this hearing, is my understanding.
On your spreadsheet, on many of these, you have an indication of last seen per Equibase and a racetrack, I assume, a racetrack and a date. Why is it that the first, I'm not sure how many that is, 10 or so, don't have an indication of when they were last seen in the Equibase?
Because we had those horses under quarantine at the time I created those spreadsheets, we knew where they were.
You knew where they were.
Correct. That spreadsheet was intended to assist states in finding these other horses for testing.
Okay. Well, then why is it that that information is present along with the notation next to several of the other horses that had been located and they were being tested?
The initial version of that spreadsheet didn't yet have some of those horses located. So
when was the initial version of this spreadsheet made?
on 10/2 is when I began issuing that spreadsheet to the affected states to find horses.
Okay, so if a spreadsheet that I'm looking at that has a handwritten notation 10/2 includes both the last seen per Equibase and a notation that they had been located and were being tested, would somebody else have added that information?
No, that's probably information I was providing to each state to be complete, so they knew that the horse that they were finding and had told me they had already found was last seen racing in their state. The states
Okay.
usually ask me for that information.
Okay, so is it safe to say that there is another spreadsheet out there
No.
that predated the October 2nd?
No, I created that spreadsheet on October 2nd and got it out to my states as quickly as possible so they could locate horses.
Now, looking at the spreadsheet, under what you call exposure, although it seems as though that really just means that this was a horse that Heath Taylor was the listed trainer for sometime during the summer of 2024. Well, let me ask you this. Is that what you mean by exposure? That Heath Taylor trained this horse sometime during the summer of 2024?
No, sir. Heath Taylor trained hundreds of horses through the summer of 2024 in multiple states. Those were horses that were potentially exposed while racing under his care in New Mexico.
So this is a list of all horses that he trained in New Mexico in the summer of 2024.
I don't know that it's a complete list. That is the list of horses that had documentation in Equibase as either having raced or worked. So there may have been other horses under his care that were there at the same time that I can't see because the information is not available to me.
Did you ask anybody for that information?
I did.
Who did you ask?
I asked Izzy Trejo.
Oh, but you didn't ask Keith, did you?
No, my computer is about to shut down here. I don't know how to get power to it. Can I pause for just a second so I can find a place to plug this in?
Yes, that'd be fine. I should
Gonna
just
have
take
to
a 5-minute break real fast. Don't have a horse seat in the state. Everybody hear me?
Yep, I can hear you, Larry.
Okay, Dr. Angela, are you there?
On my screen, it says she's waiting in the lobby.
Oh, I wonder if
Look
she,
at- I'm gonna admit
great,
her.
click it. Where's she at in the lobby? I don't have none in the lobby. Oh, okay, yeah.
She's back in.
Dr. Angela, are you there?
I am. I apologize for the technical problems.
It's okay. Do you still have a little bit of time? If not, we could actually excuse it because you got prior obligations and everything. We could actually bring you back later on this afternoon. It's up to you if you want to keep on continuing, or we could bring you back this afternoon. Our rules state we have to have a summary suspension hearing within 10 days, and we are still within it if you need to come back tomorrow or if possible today.
I will continue just to try to get what you need done.
Okay, just go with us. I mean, we know you have prior obligations and everything, so we'll go ahead and continue. So, Mr. Paul, if you want to go ahead and continue.
Um, you're aware, are you not, that Mr. Taylor has taken extensive action to assist state authorities, yourself, as well as to contain any outbreak? Is that correct?
Yes.
And what has he done?
I'm sorry, you were breaking up there.
We'll break it up. Um, uh, uh, what did he do with the veterinarian that you do not know the name of? What efforts did he make in conjunction with that veterinarian in California to identify any illness in these horses and to ensure that they received proper treatment and/or diagnosis?
I don't know. That would have been under Dr. Kloppel's watch for CDFA, my colleague.
Did you ask him what information he had as to Heath Taylor's efforts?
No, I did not.
And you are aware, are you not, that Mr. Taylor has made extensive efforts to ensure that the remainder of horses are tested regularly and to maintain and examining them for potential symptoms and to handle those issues as soon as they appear. Is that correct?
Yes.
In fact, it is correct, is it not, that Mr. Taylor has done everything he can since this was discovered to ensure that appropriate steps are taken to protect all horses, not just his own. Is that correct?
I believe he has been cooperative, yes.
And in part because of those efforts, you haven't seen a rash of additional positives, have you?
23 positives is a lot of positives. Additional from how many? Additional from the first?
From that initial wave, yes.
They were all infected together. So I'm still concerned that we have 23 positives. That's a lot.
Correct, but as you just said, they were all infected together, and so it's true, is it not, that Mr. Taylor has taken efforts since they were all infected together that have ensured that to date you have not identified a single other horse that was infected at a different time. Is that correct?
I don't know yet. We still have at least 15 horses that are under 60-day post-exposure quarantine. So I don't know if there will be more positives from that group.
And what was the exposure for those horses?
They were standing with the positive horses under the same management at the time the horses were found positive. So their exposure window had to move from 60 days to when the positive horses were euthanized or removed from the group.
And they are in quarantine, correct?
They are in quarantine in California. They are under hold order in Texas. Their quarantine was modified to a hold order to facilitate their testing.
And Heath was cooperative in that, correct?
Yes, he was.
And none of those horses are in New Mexico, correct?
Not that I'm aware of, no.
How long is your investigation going to take?
I don't know that I can answer that until we're done.
Is it possible that it will take 6 months?
It's possible. I don't expect it to take 6 months, but that is possible.
How long do you expect it to take?
I would love for this to be wrapped up within the next couple of months, but we might not get all the answers that we need in that time period.
So best case scenario, a couple months.
Correct.
Were you involved? There was an outbreak of equine disease. It's horses that had been at Sunland park a few years ago. Were you involved in that at all?
A few years ago, probably yes.
And respectfully, I failed to see the relevance of questioning about an outbreak at Sunland years ago. We're here dealing with the issue of whether Mr. Taylor should be continue his summary suspension.
Well, I think
Yes,
it's
so let's
highly
please keep
relevant.
this, let's just keep this to this case at hand right here, please.
Well, I think the handling of that matter is highly relevant to whether or not Mr. Taylor himself should be remain summarily suspended, because in that matter, the no trainers were suspended, the track was shut down, and in this case, there's not a single track that has been shut down. Is that correct?
As at this case, like I just stated, we're going to only do this case here, so we would take what you said under advisement. Please continue.
Are you aware of any racetrack that has been shut down as a result of your investigation or in connection with your investigation?
Not this investigation, no, not to my knowledge.
Are you aware of any other jurisdiction that has suspended Mr. Taylor and suggested that he is a danger to horse racing?
I don't have any information to that effect.
Now, going back to your spreadsheet, you mentioned that you had checked database and that you had asked Mr. Trejo as for information as to other horses that may have been working or racing at the same time. Did he provide that information to you?
He did.
And in what form did he provide it to you?
He sent both me and the New Mexico Livestock Board, which is my state counterpart there, a list of the horses listed under Mr. Taylor for New Mexico.
It was, what was the format of that list?
I believe it was a PDF document that would have been probably a printout from the Racing Commission database.
Did you ask anybody that was actually on the ground at either of these racetracks for information as to horses that were potentially around and, as you would say, exposed?
No, I did not.
Did you speak with any officials from either of the tracks, Ruidoso or Albuquerque, to inquire about lists of horses that were actually stabled on the grounds at the time?
I don't recall doing that, no.
Did you speak with Mr. Taylor or any other trainer to inquire about horses that may have been stabled on the grounds or even in the same barn at the time?
No.
Is that information that would be helpful for you in tracing?
Not at this point, because all the exposed horses had left the grounds at that point.
Okay, so you're not concerned with horses that were potentially exposed that were not trained by Mr. Taylor that have left and are now somewhere else. Is that correct?
I am concerned about those, but the amount of testing that's going on in the 3 states where those horses left to is our catch net for those horses. The letter to the horsemen advised them that there was a potential exposure on the grounds, and it asked them to coordinate with their veterinarian to get a new test on their horses, and hundreds of them are doing that now.
But you yourself haven't taken any efforts other than asking Mr. Trejo for a list of Heath Taylor's horses to identify which horses were potentially exposed and where they might be, and if they're racing elsewhere and if they're in other states, and where this potentially could be spreading. Is that correct?
That's not true, because my recommendation to Mr. Trejo and the Racing Commission was to put out the letter to horsemen advising of the exposure and recommending that they get tested. So that was my action in concern for the other horses.
In your investigation, it's pretty important that you, excuse me, it's pretty important that you identify what I will call patient zero. Is that correct?
Sometimes that's not possible, but it's a great goal to have.
And why would it be important to identify patient 0 in this instance?
The source of the infection could yield a larger cluster of positives that we've not yet identified. So finding the source is what we attempt to do in all cases.
And if you found patient 0, would that potentially assist you in locating the source of infection?
Yes, knowing who the initial horse was that contributed the virus to the rest of these horses would allow me to do traceback on that animal and potentially find other exposed and infected animals related to the first case.
And in fact, as you sit here today, you have no idea who patient 0 is, do you?
Typically that happens in epidemiological investigations, as we all learned with COVID.
Are there any horses that you're aware of that were treated by this veterinarian in the same way on the same dates that did not wind up testing positive?
I don't have those records yet. I wish I could answer that.
Would it surprise you to learn that there are?
No, but again, I don't have those records. That's part of the investigation that's ongoing.
Is the reason that it would not surprise you to learn that because it's possible that patient 0 was somewhere along the line of treatment, and that thereafter that patient's blood had contaminated equipment that led to the infection of the remaining horses?
It's possible. That's why we're investigating it.
But again, you do not know.
Without
Is
someone
that-
providing me the records yet, I don't have a way to complete the investigation. No, sir.
And again, you did not ask for the records until after this hearing had been set, correct?
I did not know that the two coincided. I was asking for the records on Friday last week of the Texas Animal Health Commission, and I don't know the status of them communicating with the practitioner.
Outside of the information on the spreadsheet, have you traced the status or location of the horses on your spreadsheet or any of the other horses that you've indicated have been tested?
Have I traced where they all came from? I've traced the positives. Yes, I have traced back the positives.
And how far have you traced them back? Just through the summer or all the way through their entire careers, through their birth? How far back have you gone?
I have their lifetime racing records and who they were racing under, when, and where.
And have you spoken with any of the owners as to where those, outside of race day, where those horses were located?
My counterparts in the state animal health side, so Texas Animal Health Commission, New Mexico Livestock Board, and California Department of Food and Ag, have made connections with those owners and requested more information about missing time periods for where those horses were. Yes.
But you don't have that information yet, is that correct?
I can see the gaps that exist, but no, I don't have specifics on where those horses were if gaps existed in their racing careers.
And when do you anticipate receiving that information?
I would say within the next 30 days or so. That information is ongoing.
When you spoke with Mr. Taylor, did you inquire with him at all about potential actors with improper motive, sabotage, so to speak?
We did discuss that, yes.
And what did you ask him?
I asked him if he thought it was possible that someone may have attempted to set him up or sabotage his horses, and he felt that was unlikely.
And why did you think it was necessary to ask that?
Because I was being asked that by state animal health officials who, were sharing rumors and information that needed to be substantiated or dismissed.
And which officials were sharing that information with you?
I had my Oklahoma Department of Ag officials, Texas Animal Health Commission, and California Department of Food and Ag officials that were asking those questions.
Nobody from New Mexico?
Not that I recall, no.
And what was the identity of the individual, let's start in California, that indicated that they were receiving information, even if it was in the sense of rumors that there was potential sabotage?
It was Dr. Josh Kloppel, my counterpart for the state in California.
And where did he get that information?
I don't know.
Okay, Texas. Who was it in Texas that was providing that information to you?
I believe that one was from two of my field veterinarians, Dr. Dustin Doris and Dr. Hank Hayes. They're two regional directors for Texas Animal Health Commission.
And where did they receive that information?
I don't know.
And respectfully, given that the doctor testified that Mr. Taylor said he didn't feel there was any sabotage, the commission feels that this line of inquiry is irrelevant.
Well, she was the one that indicated that it was a concern of officials that there was sabotage. And so I think that is absolutely a relevant line of inquiry. The commission is suggesting that Mr. Taylor be stopped from any work, to be summarily suspended because he is a danger. And yet apparently there were government officials in multiple states and the federal government that believed that sabotage was potentially at play. I think that is absolutely relevant to the inquiry here today.
And yet the licensee, Mr. Taylor himself, advised Dr. McCluskey that he felt there was no sabotage involved.
If we are testifying from a findings and investigation of the federal government and multiple state agencies, I think that their conclusions and their concerns are absolutely relevant. And if this were solely about if Mr. Taylor was aware of individuals that may have attempted to sabotage him, that is not the inquiry here. Bottom line is, federal and multiple state officials believed that there was information circulating within the community that Mr. Taylor was not responsible. And I think that is absolutely relevant to the inquiry here as to whether or not he needs to be stopped from working apparently indefinitely for best case scenario 6 months while this investigation continues.
We will take that under advisement, but he did make the statement to her that he did not think there was anything going on, so let's please move on.
What is the identity of the individuals in Oklahoma that you have been discussing your investigation with?
So that is Dr. Dory Parrott, Dr. Rod Hall, and Dr. Ruby, Beth Ruby.
And have they provided you any information as to Mr. Taylor's efforts to assist in containment and or the investigation?
They do not have interactions right now with Mr. Taylor because I don't believe he has many horses racing in Oklahoma right now. They were part of the investigation because Oklahoma received exposed horses from the list and needed to follow up with testing.
How many horses does Mr. Taylor have? Well, let me ask it this way. It's true, is it not, that at the moment Mr. Taylor has 0 horses racing in New Mexico, correct?
I don't know. I thought there was a horse present, but I'm not privy to that detailed information.
You thought there was a single horse, 1 horse present in New Mexico, is that correct?
I thought there was a horse, but I'm not confident in who that horse was or what their connection was, why they were in New Mexico.
Okay, so you're the the individual that is tracing all of these horses so that you can assist in containment. And as you sit here today to testify, you believe there might be one horse in New Mexico to race. Is that correct?
So whatever horse is in New Mexico racing under Mr. Taylor or attempting to race under Mr. Taylor is not on my exposed horse list and therefore is not of my concern at this time.
So other horses trained by Mr. Taylor that might be in New Mexico have not been exposed as far as you are concerned.
Correct. At this time, the investigation is ongoing.
And thus they do not, as from the information that you have, the horses that Mr. Taylor may or may not have in New Mexico to run do not pose a risk to other horses at the tracks. Is that correct?
I don't know whether that's true or not.
But you do not consider them exposed. Is that correct?
Not primarily or secondarily exposed at this time, but as we find more positive horses, that information may change.
If you find more positive horses, is that correct?
Correct. We still have horses, as I said, that are under 60-day quarantine for their post-exposure testing, and that may yield more epidemiology to follow.
It may yield, but today, as of this hearing, there is not a single horse that you are aware of that is racing under Mr. Taylor in New Mexico that you consider to have been either primarily or secondarily exposed. Is that correct?
Well, I am missing 2 horses from my list, and I don't know where they're located, so I'm not sure I can confidently say that.
Which 2 horses?
I'd have to look at the list. They're marked on there as still missing. The one that was sold in Ruidosa, and then the other horse that is reported to be in Veracruz, Mexico.
Okay, when was it sold in Ruidosa?
I don't know. I'm still waiting for that information.
Do you know if Mr. Taylor is still the trainer of record for that horse?
He is the last trainer of record in Equibase, yes.
Last trainer of record, but the horse was sold, correct?
The horse was sold, yes.
And so do you know who the buyer was?
No, as it says on the spreadsheet, unknown buyer. I'm waiting to get that information, sir.
Okay. So there's, and then there was one that you said was in Mexico.
The report is that the horse was moved to Veracruz, Mexico, but I can find no documentation of that. So we're still looking for that horse.
Okay. In your experience, though, if a horse is at the track and it's going to race, it would have been on Izzy's list, correct?
Well, I would think so, but I haven't gotten an updated list from Izzy, so I'm not sure that he's checked back on that.
Okay. So as far as you're aware, nobody associated with the New Mexico Racing Commission has checked back to see if any of the horses on either your primary or secondary exposure list are currently slotted in New Mexico and slotted to race under Mr. Taylor. Is that correct?
I believe they've been checking that, but I don't have that information on what they've found or not found.
Have you, and so they haven't shared it with you, is that right?
Correct.
But as far as your information, as far as you are aware, you are not aware of any horses definitively that associated with Mr. Taylor that are in New Mexico to race that you consider either primarily or secondarily exposed based on the information you have today.
Correct.
And if a horse is not on your primary or secondarily exposure list, you, as the USDA expert, do not consider them a potential carrier based on the information you have today. Is that correct?
Today, yes, that may change as more information is acquired in the future.
Have you called the veterinarian?
Which veterinarian?
Well, you indicated that you had requested records from a veterinarian. Who was that veterinarian?
It was Dr. Please forgive me, I get his name wrong. Holbert at ESMS, Equine Sports Medicine Services. But
Uh,
I have
are
not
you-
directly asked him for that information. As I previously testified, I'm using the state animal health officials, the Texas Animal Health Commission, to appropriately make that connection.
Why would it be inappropriate for you to contact him?
Because it's not under an accreditation violation, and USDA has accreditation concerns for veterinarians that we discuss with, not epidemiologic concerns. I always work through the state animal health official to gather veterinary records or other epidemiological information because they're a partner in our team of investigation.
But it is in your wheelhouse to investigate this disease and its source and its transmission, correct?
Yes, and I am doing that with the help of the state.
Are you familiar at all with Dr. Holbert?
Unfortunately, I have familiarity for a fraudulent blood submission and set of results that we have for him.
When was that?
In the weeks just prior to this event being disclosed.
And who was the horse?
Well, there were 14 horses that he drew blood on that were submitted to an EIA laboratory in Texas. That EIA laboratory had positive results for Mr. Taylor's horses that they reported fraudulently as negative. So we don't know what the role of that veterinarian was, other than he drew the blood that issued fraudulent results from the local laboratory, and he has connections with that laboratory.
So the lab, so he was the vet that drew the blood, and the lab said it was negative, but you think it was positive, and so
We've proven it was positive, and the technician admits that she had positive results that she fraudulently reported as negative, and she is an employee of Dr. Holbert.
And when were these tests done? When
Those
was
were
the blood drawn?
Those samples were drawn on September 18th.
Which horses?
There's a list of 14 horses, including 7 that are now positive. So I would have to look at my list, but they're horses that were located in Texas at the time.
And are they on your spreadsheet?
Yes, there are 7 positive horses that are on that spreadsheet that were part of the fraudulent submission. Yeah.
What about the other 7?
The other 7 are being held for a 60-day rebleed. So their status has not been finalized.
Okay, but I thought you had verified that they had tested positive.
7 of the 14 tested positive. The other 7 are still under 60-day quarantine for a regulatory rebleed because we don't know their final status.
Okay, so the other 7 were not what you call fraudulent. They
Well,
legitimately were negative.
I think the jury's still out on that.
Okay, did you retest the blood?
We did not retest that blood because it was not provided to us by the laboratory, but we did regulatory rebleeds of those horses that were collected by Texas Animal Health Commission. What I don't have, because I don't have the original samples, I can't compare whether the samples reported negative by the private lab are also the same samples from the regulatory rebleed horses from Texas Animal Health Commission.
And so these, what you call fraudulent results from a private laboratory in Texas, were those, the negative results, were those provided to Mr. Taylor?
They were.
And when were they provided to Mr. Taylor?
Probably on 9/18, the day the test was reportedly completed.
And do you know why those tests were run?
I believe someone in Mr. Taylor's camp or the owners, I don't know who requested the test, requested Dr. Please forgive me, I'm getting his name wrong, Helbert, to go draw blood from those horses. And we only found out later that those had been sampled by a private practitioner before we arrived to do regulatory bleeds on those same horses.
Okay, so as far as you know, somebody within Heath Taylor's orbit was concerned enough to request a blood draw, and then the information that he received back from an, I assume, accredited laboratory was that those horses had all tested negative.
That's correct. He did receive that information and not, it was not legitimate.
What was the name of the tech that had
The technician's name is Leanne Gilkey.
um, those the 7 horses that you are waiting on rebleeds from that group of 14, had they also been, or do they appear on your primary or secondary exposure list?
I don't recall. I believe they're in the secondary exposures at this point because they were sampled with the positive. So they were standing with the 7 that were subsequently identified as positive. So yes, they'll be on the secondary exposure list.
And so but the 7 that were definitively, as of today, identified as positive, those are included within your spreadsheet.
Yes, they are.
On the list of horses. Okay, and those are included within the list of horses that Mr. Taylor informed you had been treated by this doctor in standard race preparations on that. I'm not sure if it's a weekend, but I'll call it the weekend because I don't have a calendar in front of me. But those days, excuse me, those days at the end of July. Is that correct?
Mr. Taylor indicated that all of the positive horses had undergone treatment by that veterinarian on those dates.
Okay. And that includes the 7 that you have now identified that he received a report from in September, middle of September, that they had actually tested negative in September.
That's correct. That's correct.
When the blood was drawn in September, none of those horses were in New Mexico, were they?
No, they were all located in Texas.
Sorry, I just have to reorganize my paper. uh, um, is the horse Relentless Chula under quarantine at the moment?
I believe that horse is still under hold order, but yes, it's under a movement restriction by Texas Animal Health Commission.
And when was the last time that it was tested?
I would have to go look that up. It has had an initial test. It is on the rebleed list.
Okay. Is it on the rebleed because the initial test was negative?
The initial test was negative. That's correct.
Okay. And that horse is currently in Texas. Is that correct?
I believe so.
What about the horse Cowgirl Chick?
Cowgirl Chick is located in Texas and is under quarantine.
Okay. And has that horse been tested?
The initial test on that horse came back negative. It will be rebled.
Okay. And what was the believed potential exposure for Cowgirl Chick?
The believed potential exposure was that horse, according to Mr. Taylor, was also treated on those dates by his veterinarian, along with all the positives.
And what about Relentless Chula? What was the potential exposure as far as your understanding for Relentless Chula?
Will you give me a moment to pull up my spreadsheet because it says it on there, and so you're going off of my memory, but I'd like to go off of my information if I can.
Sure, sure.
1 second.
And when you do that, if you could tell us where on the spreadsheet it would have that information.
Yep. So the exposure during prep for column
Okay,
is what I'm looking at there for their possible exposure dates.
gotcha.
So
So that
I
means, so
apologize,
then,
but Stuart Fontenot, given that it's a little after 10 o'clock now, I just need to inquire how much time the stewards have on their schedule before they need to get to other matters, given that Mr. Lindenberger is still questioning the doctor and we do have another witness as well.
Mr. Limburger, how much more time are you gonna need with this witness?
not much longer, and I apologize if I could just get a few minutes to run to the bathroom and try and get something warm for my throat. I've been
Okay,
sucking down
because-
cough drops.
That's fine. We just,
And the taste is
not trying to
starting to
rush this or
taste.
anything. We could take a 5-minute break real, well, I'll let you go.
I
and go
appreciate it.
Turn to other matters and then we can move on from there.
I appreciate it. Thank you.
Thank you, Stuart Fontenot.
Much appreciated. A little warm liquid It's a lot better than tasting cough drops for an hour at a time. Thank you.
We're just waiting on Billy to pop back in here and then we'll go on with it. Here he comes now. They hit, okay, we're back on record.
Just a few more questions. In your attempts to locate all these horses, it's true, is it not, that Mr. Taylor was very forthcoming in assisting both yourself and state authorities with locating all the horses that he has been training? Is that correct?
It is correct.
And you haven't, there actually hasn't been a time in your investigation or that you're aware of in the state's investigation where Mr. Taylor has not been forthcoming with information, correct?
Correct.
He's been very open and honest about what he knows throughout this entire process, correct?
Mostly, yes.
And then just real briefly, going back, I'm a little bit confused by the situation with the testing in September. The 14 horses that you indicated were tested in the middle of September, you indicated they were located in Texas. Were they at a track or were they at one of Mr. Taylor's facilities?
I don't know where those were located. I apologize. Since it was done by a private practitioner, I don't have confirmation of where they were stabled. They were obviously together.
And how did you come to learn that they had been tested?
The Texas Animal Health Commission Regional Director, Hank Hayes, went out to bleed at Lone Star Park some of the horses from the list that you have as an exhibit. And when he went to rebleed those, someone there at the track spoke to him and said, "Oh, why are you bleeding those? A veterinarian already came out and bled some of those." And so I believe that disclosed the information that a private practitioner had come out already to bleed those horses prior to Dr. Hayes arriving to do the regulatory bleed. And he investigated that, which is how we found that those results had been issued fraudulently.
Okay, and so that's how you learned that the lab, at least one person at the lab knew that several of those horses who have now been confirmed positive had tested positive, but that the report that the lab issued to Mr. Taylor indicated that they were negative.
Correct. Leanne Gilkey made that
that correct?
disclosure to Leanne Gilkey made that disclosure to Dr. Hayes when he investigated the previous bleed.
Do you know if prior to right now, if anybody had ever informed Mr. Taylor that he had received what are believed to be fraudulent test results?
Yes, he was informed prior to now that those results were fraudulent, and I have since had Global Vet Link void those fraudulent results from the system.
Did you notify him?
I spoke to him about it, and someone else spoke to him about it before that, but I don't know who informed him first. But yes, he was informed prior to today that 7 of those results were definitely fraudulent, because by that time we had retested. We had gotten Leanne Gilkey to forward the suspect samples to NVSL, and we had since proven that they were actually positive on 9/18.
Is there a written statement from Ms. Gilkey?
Not yet. We have a USDA Investigative Enforcement Services investigation that's ongoing into the laboratory and that activity that occurred. And so that will be the documentation, will be the IES investigation report when it's completed.
Is there any other documentation that you're aware of as to that information from Ms. Gilkey? For instance, is that information contained in any of your reports, to your internal reports that we were discussing earlier?
It is contained in an email that I sent, a package email that went to the area veterinarian in charge in Texas, Dr. Louisa Collins. And Louisa Collins initiated the IES investigation into the laboratory. So that is documented in my emails, yes.
Was that information shared in any way with the New Mexico Racing Commission that you're aware of?
I believe I mentioned it by phone to Izzy Trejo, but there is no physical documentation that I'm aware of, no.
Okay. And would that have been, when you say mentioned by phone, would that have been in the conversation that you were discussing earlier about updating the standards for testing?
Correct. Yeah, and we talk occasionally throughout this investigation while he's trying to help locate horses for the other states.
I don't have anything further. Thank you.
Okay, Mr. Bustamante, you got any questions you want to ask from this?
Stuart Fontenot, no additional questions for the doctor. Doctor, we sincerely appreciate the time that you took here and the fact that you were able to move your presentation. Thank you on behalf of the Racing Commission and everyone here.
Just hold on one
Best
second.
wishes.
Just hold on one second, please. Mr. Billy, do you have any questions for her?
No, I have nothing further. No, thank
Okay.
you.
Well, thank you very much, Miss Angela, Dr. Angela, and have a good day.
You too, guys. Thank you.
Okay, Richard, do you want to have your next witness?
Thank you, Stuart Fontenot. At this point, the New Mexico Racing Commission calls Dr. Brandy O'Sullivan.
Dr. Umbram, unmute yourself.
Thank you. Good morning.
Okay, please state your name and how you're licensed, please.
Yes, my name is Dr. Brandy O'Sullivan. I work as an official veterinarian for the New Mexico Racing Commission.
Okay, you're going to be giving testimony. Will you please raise your right hand? I'm going to swear you in. Do you swear to tell the truth, the whole truth?
Yes, I do.
Okay, Richard, you go ahead and go.
Thank you, Stuart Fontenot. Good morning, O'Sullivan, and thank you for your patience. And Dr. O'Sullivan, in your education to become a vet, as well as your experience out in the field, do you have experience with and information about equine infectious anemia?
I do. It is taught to us in our veterinarian training in school. It appears again on our national board exams. I've worked in equine practice since I began, so it's naturally circling in what I do. Specifically, the last 3 or so years, I've been working in racing regulation. I began with the state of Michigan and now New Mexico. And during my time with the state of Michigan, it was one of my responsibilities to just ensure all horses participating had their health papers in, to review them for validity, make sure everything adds up. So I have experience regulating the disease, yes.
Thank you. Doctor, exactly what is EIA?
Yeah, EIA is a blood-borne viral disease caused by the equine infectious anemia virus. It is in the same family of viruses as HIV.
And when a horse is infected with it, what are the effects or impacts on the horse?
Yeah, well, incubation with this disease, incubation time varies from what's published is, I think, 15 to 45 days before signs can start. But, most horses show no signs. Some horses will flare up with non-specific acute signs, such as like fever, lethargy, edema, but they're all lifelong chronic carriers. There's no cure, no treatment, no vaccine. So the virus lives in their white blood cells and can get elevated during stressful periods. Often horses will succumb to this disease naturally. It can be fatal.
For those horses that have EIA and somehow survive being euthanized or dying from it, what kind of life do they lead?
Right. Once a horse is identified positive, it is a reportable disease. So it is reported, as we know, and it is tracked. And once that horse is identified, um, there's the option of euthanasia, or they allow a quarantine, I think 200 yards for life. You have to be 200 yards away from any equid so that a vector couldn't transmit the disease. It's such a like a challenging quality of life and management situation for horses to just be isolated alone 200 yards from things, as well as still have the option to flare up with the disease. So euthanasia is most commonly elected, unfortunately.
Doctor, what is a Coggins test, and exactly what does it look for, and how does it work?
Sure, yes, a Coggins test is what we use to diagnose EIA. A Coggins test is an antibody test, similar to the test we have for COVID. The issue with the antibody test is that it leaves a window of time where a positive animal could test negative. In horses, this length of time can vary, like depending on the animal's immune system and when they're going to seroconvert or show antibodies in their blood. I mean, this can take 15 days, 45 days, 90 days or more, depending on how the virus was acquired, whether through like direct iatrogenic or in a large amount or from like a biting insect. So as we've discussed, it can take 60 or more days for a horse to test positive. So it's why when there's an exposure to EIA, it's kind of essential not only to retest, but to quarantine. But we use a Coggins antibody test to diagnose.
Okay. And doctor, based on what you just testified to about, if I understood correctly, the Coggins test looks for whether the horse has antibodies that are hoping to fight the virus. Is that correct?
Correct. It's the test is an antibody test, so we are testing the detection of the P antigen once that is in the blood, once the animal has seroconverted, as we call it. So that can take a unknown amount of time.
So is it correct to say that a horse for which a negative Coggins test has been produced actually is infected with EIA, but at the time they were tested, they hadn't produced enough antibodies in order to produce a positive result?
That is an option. When we receive a negative test, it's not definitive. Like you're saying, we receive a negative, that just means that time the blood was pulled, the animal hadn't seroconverted if they do have it. It doesn't totally, one negative Coggins does not rule out a positive animal, no.
Okay. So in a situation such as Mr. Taylor's, where 23 of his horses have been diagnosed with EIA, all of them are euthanized except for one which died, would you as a vet have any concerns about a horse in his care and custody control being located near other horses or on the grounds of a racetrack, even if they had produced a negative Coggins test result?
In this specific situation, yes, because we're still within the 60-day time period, and 60 days is even kind of short as be it, but we've had an exposure. We don't know the exact time. As far as I'm concerned, we're still within 60, 90 days where we need to do rebleeds to confirm we don't have any carriers in the herd left. I know we've found a lot of the initial positives, but we haven't completed the full time to determine if there's other horses that are going to pop up or not that just haven't seroconverted yet. So I do have a concern about that.
And is one of those concerns based on that? Obviously, there's flies at any racetrack or where livestock are. Is the concern about a fly biting that horse that in fact has EIA and then possibly biting another horse and then infecting that horse?
That is possible. Yes, I would hate to have a positive horse come on even participate in racing. That's not the health that a racehorse should have. So that is concerning, as well as what you mentioned, the possibility for transmission while on the racetrack through vectors or, gosh forbid, sharing iatrogenically. And yes,
the Dr. Angela testified earlier that it was not possible to pass EIA by touch, human touch. Would you agree with that?
I agree with that. It is non-contagious. It is blood-borne. So it has to be blood to blood. So I agree with that, nor have I never heard of any case of that in my history.
Okay. In your work as a vet and working with racehorses, is the presence of EIA or EIA infected horses either at a stable or in the grounds of a racetrack, is it a cause for concern among vets and the racing community?
Yes.
And why is that the case?
For reasons you just mentioned, we just discussed, such as one, a horse with this type of bloodborne virus should not be competing at this type of level that is not safe or humane. And then as well as you pose the risk for spreading the virus through mechanical vectors, blood biting insects, or gosh forbid, sharing veterinary items.
Okay. And the doctor earlier testified that the disease could be transmitted by either a biting fly or by a human intervention. Would you agree with that?
I would agree with that. Those are how this disease is spread mechanically, blood feeding vectors, just as you mentioned, iatrogenic, including contaminated needles, instruments, blood transfusions, blood products. You can also, I think you can also acquire this mare in utero, but that's not on the table here. So,
assuming just for argument's sake that why would plasma or blood from one racehorse be transmitted or put into another racehorse, if you know?
I'm going to object because as has been, Mr. Bustamante has made abundantly clear with the last witness, we are only here on this situation, and I have yet to hear, nor am I aware of any information that suggests that occurred. And so, therefore, this testimony is entirely irrelevant to this situation.
So, Richard, you want to rephrase that question?
Stuart Fontino, thank you, and I'll just withdraw the question. So,
Okay.
Doctor, based on your experience working as the regulatory vet for the Racing Commission, as well as your private vet experience working with racehorses, anything else to add regarding your concerns over having a horse that is tied to a trainer that has had this many horses infected with EIA being located on a track or at a training facility or at a stable with other horses?
yes. Will you repeat the first part of your question, please, for me?
Yeah. Based on your training and experience, anything additional to add in terms of concerns over a trainer such as Mr. Taylor with 23 cases of horses under his care, custody, and control, having any of his horses on the grounds of a racetrack or entering in a race or at training facilities or stables in close proximity to other horses?
Sure. I guess my concerns are, I just want to follow federal protocol for an exposure of this disease, and I don't think that the ample amount of time has passed. So I'm concerned we're kind of in the window where more horses might pop up positive and we could continue to spread the disease. And then when it comes to racing, I operate everything under the New Mexico racing rules, and everything is trainer responsibility. So whether from the clothes the horse is wearing to how they perform.
I'm going to go ahead and object that this witness, A, is opining on ultimate matters, which are for the stewards and the commission to decide. B, now we're getting into legal opinion, and she is obviously not qualified to provide legal opinion.
Richard, rephrase that question, just, Mr. Sullivan, are you putting this out there as your personal opinion?
Oh, I'm
It's a
sorry.
professional opinion.
No, I just meant I enforce the New Mexico racing rules and the regulation rules and everything. The trainer is licensed and everything is trainer responsibility. The horse, all the horses I look at and all their care, I consider everything trainer responsibility. So I just, they are the responsible party for the animal for me. So I look at them as the responsible. That's all I meant. I just enforce that.
Okay. You can proceed, Richard.
Dr. O'Sullivan, at this time, that's the only questions I have at this time, and I thank you so much.
Thank you. Yes.
May have some. I have a couple.
Mr. Paul, do you have any questions?
Just a few.
Okay.
And back now.
You froze on us.
All right. I cut off my video. Does that help?
Yeah, let's try that.
It's true, is it not, that the industry standard in racing is that a horse needs a negative test within every 12-month period, correct?
That appears to be the common rule that is in place by facilities that we go with. Yes.
And that was the practice in New Mexico up until a few weeks ago, correct?
From my understanding, the race meets I regulated, that was the enforced track rule. Yes, is you have to come on the grounds with a clean 12-month Coggins. Yes. And then, yes, I was aware that that has been modified now in Albuquerque. Yes.
And so, as far as you're aware, the New Mexico Racing Commission itself didn't actually require anything more than one negative test a year. Is that correct?
That has been routine for the past few meets. We've been a 12-month Coggins has been sufficient. Yes, I think typically that is the standard, and that can get escalated if there's need or an outbreak or something of concern. Yes.
And every single one of Heath Taylor's horses complied with that standard, correct?
That is my well, at what time are we referring to? Like during Ruidoso meet? Is that what?
Well, at any information that he ever brought a horse onto a track in New Mexico that did not have a negative test within a 12-month period?
No, it's my understanding that if he had horses on the backside of the race meet, he has complied with the requirements to be there.
And you indicated that you consider it to be within a window and that the incubation period can last several weeks. And I think that you indicated that a positive test is sometimes 60 days or more. And so that even a negative test does not rule out a positive animal. Why is it then that the Racing Commission did not require animals to be tested every 45 days, 60 days, 90 days? Why is it that the Racing Commission was completely okay with one test every 12 months?
No, that's the yearly Coggins is standard throughout like the horse industry at any equine gathering event. It's standard a 12-month Coggins. I'm sure there's probably research or literature done that is kind of the standard to maintain health in a herd. Now, like I said, if there are things that pop up, that should probably be modified if there are outbreaks, but that's the standard, the 12-month. And at the time when I was working, say in Ruidoso, I didn't have any notice of any exposure, any risk. So the 12-month Coggins to enter at Ruidoso was standard protocol.
But the New Mexico Racing Commission did not, until the last couple of weeks, require anything other than that specifically, did it?
let me, specifics of your question. I mean, once, from my understanding, once we have a risk identified, the requirement was modified to keep things safer, doing retest, now 30-day Coggins. That's all I know.
And Mr. Taylor, as far as Mr. Taylor has been in compliance with any requirements of the New Mexico Racing Commission as it relates to EIA and testing and timing of testing, correct?
As far as I'm concerned, yes, because if he wasn't, his horses can't come on the ground. So yes.
And as far as you're aware, well, you have information, do you not, that Mr. Taylor actually has been extremely active in responding to the positive tests and assisting officials such as yourself in locating horses, making sure horses are tested, making sure appropriate horses are quarantined, that sort of thing, correct?
It has been brought up during this hearing and I've heard it, but I don't have any direct contact or need for information for him, so I can't really directly comment.
Do you have any role in the in that process in the locating horses, making sure that they're quarantined and or tested?
I don't at this time. I'm not currently working the race meet in New Mexico. I don't have any ties to that right now, no.
As far as you are concerned, correct me if I'm wrong, but it is your understanding that the sole reason that Mr. Taylor's license has been summarily suspended is the fact that he is a trainer and some of his horses tested positive for EIA. Is that correct?
That's partial my understanding. My understanding is that we have a trainer and we have an ongoing outbreak and investigation right now, and I don't have a known source for this, so it's unknown how it happened. That's concerning. I'm not sure if there's history with this licensee. I don't really know a lot about that, but from my understanding, history and then this current outbreak are factors. Yes.
Were you involved at all with providing information to anybody at the Racing Commission, including the stewards, as it relates to a decision to summarily suspend Mr. Taylor?
No.
Is this the first time that you provided information to the stewards in any way, shape, or form as to this case?
Yes. Yes.
And the only other questions I have is I think you just mentioned that as it stands now, neither you nor to your knowledge any other official has identified the initial source of this outbreak. Is that correct?
Correct.
And it is entirely feasible, is it not, that if horses were being treated by a veterinarian and one of the horses was positive and then some of the equipment became tainted by that positive horse, that horses treated thereafter, there could be transmission that way. Is that correct?
You know, that is a possibility on the list for transmitting this disease. As I follow and learn about the pattern of positives and how they're coming up, it doesn't seem possible to me that it is through medical supplies, but that is an option technically. Yes, I guess.
I'm sorry, you had testified considerably about tainted medical supplies previously, and we heard a lot about tainted medical supplies from the previous witness. It's now your testimony that tainted medical supplies can't actually transmit this?
No, I just said it's totally a possibility. It's definitely on the list for this disease, but in this situation, the pattern of outbreak doesn't seem to fit it. I'm pretty sure the other veterinarian touched on that, but that's all.
The pattern meaning that all these horses were treated by different veterinarians on different days. Is that what you mean?
No, I don't know about that. For me, it's more of the slam dunk every single one at the same time quickly. Doesn't fit blood left over in a needle to me, scientifically.
If it wasn't every single one, would that alter your opinion?
I would say if this outbreak looked like sporadic, maybe one horse here, another horse here, and that was it, maybe that would be higher on my list, but just based on how it's revealing itself, I'm not sure that that's my main thought.
What if there were horses that received the exact same treatment on the exact same day that didn't come down with the disease?
Well, we don't know where the source is, so I don't know if that treatment had anything to do with the EIA, so I don't know.
I don't have anything for it.
Dr. O'Sullivan, just to make sure I understood your testimony, with respect to the possibility of tainted medical equipment, explaining the amount of EIA infections in horses under the care, custody, and control of trainer Taylor. Did I understand your testimony correctly that in your opinion, that would be improbable? Is that what I understood you to say?
That is my opinion, yes.
Okay. And did I also understand you to say that that would be improbable based on the speed with which these horses developed EIA to the point where they either had to be euthanized or one died?
Correct. That is one of the factors, yes.
Okay, all right. And doctor, as a regulatory veterinarian and working with equines, is it a reasonable concern that the race, or would it be a reasonable response for the New Mexico Racing Commission to modify its policy or requirement on Coggins once it learns of a large number of infections by a trainer connected to all the horses who runs in New Mexico, has horses on the grounds of racetracks in New Mexico? Would that be a reasonable basis on which the commission would modify its Coggins requirement?
I'm going to object to the form of that question. I mean, what the heck does reasonable mean? Who is it reasonable to? That really what he's asking for is a legal determination, and she should not be making that. That if that were an issue for this hearing, that would be a decision that needed to be made by the stewards, and that she should not be testifying as to any ultimate conclusion such as that.
Let me modify the question. Based on your training and experience as a regulatory veterinarian who's familiar with EIA, would it be reasonable for a regulator to modify its Coggins policy when it sees an enormous amount of outbreaks tied to one trainer who in fact races and participates in racing in the state of New Mexico?
That was essentially the same question, so same.
She's doing you're asking her for her personal opinion. I mean, not personal, for professional opinion. Is that what you're asking her, Richard?
Based on her training and experience as a regulatory veterinarian working with equines, yes.
Okay, so her, Miss Brandy, please do your professional opinion.
Yes, in my professional opinion, the notification of any positive or any outbreak, no matter, definitely necessary and recommended by me. Yes.
Okay.
And at this point, Stuart Fontenot, no further questions for Dr. O'Sullivan. Dr. O'Sullivan, thank you very much for your time. Oh, my apologies.
Hold on. Billy, do you have any questions?
I just have, if you don't mind, I just have a couple of follow-ups. You can't see me because we're having to share desk and the same flies in the bathroom, here at the steward's office. Mrs. Sullivan, you are a, licensed veterinarian, right?
Correct. I am a licensed veterinarian in multiple states, one being New Mexico.
Okay. And I know you're testifying virtually, but you're no longer working at the New Mexico Racing Commission now. Is that correct?
I'm not employed for the Downs at Albuquerque race meet, which is going on
Okay.
right. So I'm home in Michigan. Yes,
Okay. But you were employed in Ruidoso,
correct.
and that included the Ruidoso meet at Ruidoso and the Ruidoso meet at the Downs at Albuquerque when it got moved up here. Is that right?
Correct. I participated in both stretches of those. Yes.
Okay. Are you aware any information now that you've left as to whether or not that there are any horses here in New Mexico that are being run by Mr. Taylor at any race meet?
Well, from what I have followed, it's like you've presented the timeline. I worked Ruidoso. I came home to Michigan. I heard about this. I first heard of horses went to LoSal, were ill and were tested and were under Heath Taylor. I heard about that. I then kind of followed it as it spread around. I was just specifically keeping my ear keen to the state of New Mexico. At one time, I was told there was one horse in New Mexico that was positive. I followed up on that with the veterinarian. I forget who gave me that information. Yes, a veterinarian who was there and told me that that horse has been removed in the livestock board trailer. It's under their watch. It's being handled. I think they're going with quarantine. I'm not sure, but I was aware of that horse and then its removal.
Okay. You obviously, I take it you have not talked to Mr. Taylor.
No, I think maybe we have said a hi and bye maybe once in
Okay.
my career.
I guess maybe that wasn't a very good question. As it relates to this issue, have you talked to Mr. Taylor about this situation?
No.
All right. Have you talked to, do you know who the vet that was involved here with Mr. Taylor when he was at the Ruidoso meet that was brought up here to Albuquerque?
I don't.
Okay. So the last question I have is, maybe I'm just a little confused as to what I heard for the first time, that you do not believe that, in your professional opinion, that this outbreak has to deal with some type of medical equipment. Would you explain what you're talking about, medical equipment?
Sure.
Am I wrong? Let me back up. Am I wrong to say that that's your professional opinion, you think?
No, you are not incorrect with that. Based on what I've been following from Michigan, the pattern of this outbreak, when it first began, okay, I think it was 6 or 7 horses. Everything is on the list. We have no clue. And then as it progressed, it just was so many horses so rapidly. Like the other veterinarian mentioned, these are things I consider in the back of my head. A fly, if it is a fly, isn't going to just go in one barn, horse to horse. I would argue also there's, when blood is taken from a vein and it is sitting in tubing or a syringe, it only lives for so long. And
Hold on, Brandy, hold on a second. You
Yeah.
just broke up on, you're freezing up on us. Can you
Sorry.
just back up a little bit what you were saying?
Sure. I don't know where you heard me, but just like the pattern, like the other veterinarian was saying, well, when we first heard about it, everything's on the table. We have no clue. It was about 6 or 7 horses. And then as the information just kept coming in, it was so many horses so quickly, all in one area. So based on what we know, okay, blood biting insects, it seems such low likely that a fly is going to bite only this group of horses right here. So then that kind of goes lower on the list as options. The other thing to consider, like we've been talking, is medical equipment, such as needles and syringes. You know, and I've ran this through my head in my professional knowledge so many times. And I just say, like, if I were to line up 20 horses, and if the first horse I poked was positive and I had residue in my syringe, and I went and poked all those other horses, 1 or 2 maybe would pop up. It's not 100% slam dunk. So based on the pattern, you know, sharing of needles and syringes and blood left over in lines is lower on my list, in my opinion.
Hold on 1 second, Brandon. You just back up just a little bit more because he just froze on us.
Crap.
We got to hear about 3/4 of that.
Yeah, about 3. Yeah.
Okay. Just, I'm just commenting on how we have our ways we know it can be spread. When we first start, we don't know. It seemed low likely that it was a biting insect vector. Will you then consider blood instruments, needle and syringe? I don't know if you heard my story, how I consider it in my mind. If you lined up 20 horses and the first horse you poked was positive and you poked every single horse after, not every horse is going to have the disease. It's that's just how it goes. Red blood cells die when they hit oxygen. You know, they sit on a syringe and tubing. So it's just not such a slam dunk. So that leaves the highest on my list, in my medical opinion, is, you know, kind of like a product or something directly being given. It seems to fit this pattern most, in my opinion.
A contaminated product or what type of product?
I mean, yes, in my mind, something is contaminated and it's being put in the animal. So I'm not sure if that is like a blood product, which we see sometimes with blood transfusions, or, you know, adding red blood cells to racehorses. I've seen that before in my career. The original horse that is bled isn't negative, and then that blood is directly put into animals, making them positive. I've seen that.
Well, let me ask, I'm sorry. Once these horses have been euthanized, I understand that there's a procedure that, you know, thereafter concerning the necropsy and testing and getting blood or other materials from these horses. Is that going to explain this process or not? Whether you're right or who's wrong, or whether we're ever going to be able to figure this out?
I'm not sure if I understand your question all the way, but my thing, what I would brainstorm with what we're talking is not a dead horse. It would be a horse that is alive, that is carrying this virus, that is, you know, standing, acting well, and that maybe no one is aware is positive, or maybe they are, and maybe that horse is providing donor red blood cells to another animal. I don't think it's from like a dead animal, if that was your question.
No, I guess my question was that we've had so many horses that have been euthanized, obviously, and I'm assuming that there's processes available in the medical field or the veterinarian field that they can go back and look to see what could have happened, or what is in their blood system, or what is in other parts of their body that may have led to this disease, if it's not coming from flies and something like that, if indeed something was injected. Does that make sense?
Not all the way. I know that the pathologist that will go over these necropsies when these animals are euthanized, there are certain lesions that you can look throughout the body, just given a body, to see this virus. I think that is being paired with the blood test to determine the positive or the presence of this virus, but I'm not aware of anything medically that could tell us anything further. I think if it was available, we would be relying on it. I don't know of anything further, if that is your question.
Okay. All right, I have nothing further. Thank you very much.
Thank you.
Richard, you got any other questions?
Yes, Stuart Fontenot. Dr. O'Sullivan, I believe I heard you testify just a few minutes ago that in your experience working with racehorses, you have seen instances where blood or plasma from one live horse is transmitted into another horse. Is that correct?
Correct.
Okay. If you know on why would somebody do that with a racehorse? If you know.
Yeah, my experience is I've heard of people trying to like enhance oxygenation, I think, or like red blood cell capacity. I think that's what they're doing. So it's my understanding that horses may get blood transfusions or receive like more red blood cells in the attempt to increase oxygenation capacity and improve performance and breathing in the race industry.
Would you agree that the possibility is very great that a horse is going to get more? Let's assume for argument purposes that a horse is infected with EIA. Would you agree that more than likely, if that blood is put into another racehorse, that's probably going to be more blood put in that horse than they would get from a fly?
Yes, and exactly. Blood transfusions for horses are typically hundreds of, 5 liters, large amounts of blood. I've never seen a transfusion of like milliliters in a horse, whereas like you're saying, a biting fly is going to deposit like 1 or 2 drops compared to like a 5-liter transfusion.
And I understand you're not an epidemiologist, but based on your training and experience with EIA, is it possible that if a horse is infected with EIA because of a blood transfusion or plasma transfusion, that may result in the horse developing EIA in a much more rapid fashion as compared to if the source was from a fly?
Yes, that would be the most rapid way. As you're saying, the more directly introduced into the bloodstream, the faster and that you're going to seroconvert, have symptoms, show positive. I agree with that, yes.
Okay, all right, thank you. And then just to clarify, when you testified earlier about the transfusion of blood or plasma from one racehorse to another racehorse, did I understand you correctly that one of the reasons for doing that might be to somehow try to gain a competitive advantage in a race?
Correct.
All right, thank you, Dr. O'Sullivan. We appreciate you.
Thank you, yes.
No further witnesses from the commission, Stuart Fontenot. And Stuart Fontenot, you're muted.
Mr. Limber, do you have any more questions for this witness?
Um, just a couple. The incubation period for this, even with a fly bite, is anywhere from a handful of days to a few months, correct?
The incubation for this disease, yes. No, we don't know how, yes. No matter how it's given, that is the incubation time for this disease, yes.
Even from a fly bite.
Correct.
And so as far as you're aware, it's true, is it not, that every horse that tested positive involved in this case was within, it was roughly within a month to 2 months of having been at both the Ruidoso Downs racetrack and the Albuquerque Downs racetrack, it wasn't like these horses tested positive one day after Mr. Taylor said that they received treatment, correct?
Yes, I am unaware of the day Taylor claims the horses were treated, but yes, they were in Albuquerque in August to the 1st in September. So if they came up positive in September or October, yes, that would be within time that they were in Albuquerque.
Even if they had all been infected, and I understand that you don't think it's likely, but even if they had all been infected by, regardless of how they infected by transfusion, by tainted equipment, by a fly, you still would expect them to test positive in roughly the same time frame that they did, correct?
Well, no. We use, our 45, 60, 90 days the best we can. If a horse was bit by a fly, I think that it would, in my experience, it's going to take longer to show up positive. I don't know when that's going to be. I don't know if it's one fly, but in my experience, it will take longer compared to direct inoculation with milliliters of the virus.
And were you in Ruidoso following the floods?
I was in Ruidoso following the kind of during the flood time. Yes.
Okay, so you were there right after the forest fires, correct?
Correct.
And were you aware of complaints within the community of an increase in biting flies around that time?
No.
I don't have anything further.
Okay. Richard, you got any other questions?
Fontenot, no, and thank you. Thank you, Dr. O'Sullivan.
Okay. All right, Brandy, you may be excused. Thank you very much. Okay, Richard, do you have any other witnesses you want to call?
Fontenot, at this time, no further witnesses. If you'll permit me, I do have a brief closing statement.
Hold on a second. We got these other sides. Do you or Mr. Limburger have any witnesses you want to have?
Can we have about 5 minutes so we can decide
Okay.
what we want to do if anything going forward? And I guess my question is
We're good.
we're good?
Yeah, we're good.
We're good for the rest of the morning?
Yeah.
Okay, all right. Good.
Okay, we're gonna take a 5-minute break.
Thank you.
I gotta call Paul and get him on the phone.
Okay. No,
I mean, Richard doesn't have his on.
no, we're good on that.
Can you
Can
hear me from here?
yeah, can everybody hear me?
Yes, Stuart Fontenot.
Billy, if you would stand right there in that chair. Let's see, make sure they can hear you.
Okay.
Go ahead and say something.
Testing. This is Billy Blackburn.
Can you guys hear Billy?
Yes.
Okay, Don's
Where's
camera's
your-
screwing up. Huh?
Where's your
Right here on
video?
this, right here on this,
Okay, so sit over here.
you won't be. Yeah, you can sit right there.
Is this better? Can you hear me better on this side?
Anybody?
Yeah, I can hear you fine there, Billy. Either place, I could hear you.
Okay, we're good right here. Let me go ahead and start the record and everything. All this stuff. Okay, we're now back after a brief break. It's about 11:20. Mr. Billy, who would you like to call for your witness?
We would call Heath Taylor, please.
Okay. Heath, I know you already was sworn in and everything, so you are under oath.
Yes, sir.
You please state your name for the record.
Heath Taylor,
Mr. Taylor, how were you employed?
professional racehorse trainer,
And how long have you been doing this?
28 or 29 years.
And what type of horses do you regularly train?
Typically quarter horses.
Okay. And who are some of your owners that you train for? Are they quarter horse owners or are they thoroughbred owners?
Yes, quarter horse owners.
All right. And have you ever won any professional awards?
Yes, sir. I've been very fortunate, been AQHA Trainer of the Year, third leading trainer in the history of quarter horse racing by money earned, third most stakes wins, approximately 100,000 shy of being the third person to ever reach 50 million with Paul Jones and Blaine Schwanevelt. So I've been very fortunate that owners have sent me quality horses that have run at the top level races. Yes, sir.
Did you run any horses in Ruidoso this summer?
Yes, sir.
And how many horses did you have there?
I had a lot of horses there. As far as number, they testified early hundreds, but I don't think it was that particular many horses. Probably had set 60 to 70 horses at different times at Ruidoso. It fluctuated.
And while you were there at Ruidoso prior to coming to Albuquerque, did any of your horses ever test positive for any type of substances?
No, sir.
Have you been notified that any of the horses that you ran at Ruidoso this year tested positive for any type of prohibited substances?
No, sir.
As it relates to prohibited substances or medications?
No, sir.
And or as far as you're aware of, have all of the purses been paid as to any race that you were involved in the state of New Mexico during the Ruidoso / Albuquerque meet?
Yes, sir. As far as I'm concerned, they're all paid.
And as a result of that, did you have any positive test for any of your horses for prohibited substances or over medications?
No, sir. Not in or out of competition.
All right. And let's talk about the horses that you ran earlier this summer. Were all of those horses tested prior to the race, out of competition testing?
Typically at Ruidoso or New Mexico, usually because of the vast number of horses in the trials, 300 or 400, usually what they do is you run the race, they do post-race testing, urine, blood, and sometimes they'll pull occasional hair. Then usually the Tuesday following the finals, they will call all the finalists to the test barn and they will test blood, urine for those races. Sometimes for races as big as All-American, they will test saliva as well, sir.
Any of the horses that you had at Ruidoso and then brought up to the downs at Albuquerque, did all of those have Coggins test?
Yes, sir.
And do you know what dates that all of those were, or were they close to the time that they ran, or it's a yearly test? So you were in compliance with all the racing rules in the state of New Mexico, is that right?
Absolutely in compliance. Typically, as was testified earlier, a lot of times they're taken in the beginning of the year because that'll allow you to make the whole January to December race circuit. However, as many horses come in to Ruidoso, some come from Remington Park, some come from private owners. You'll have all kinds of different dates. But to answer your question is yes, every horse was in compliance. The horses, when you turn the papers into the racing office, actually have to have the Coggins papers attached to them. They have to have those also in order to be eligible to be in the race.
When you were racing here in Ruidoso and the downs at Albuquerque Ruidoso meet, were you racing horses in any other jurisdiction?
Yes, sir. At that current time, I was racing horses in Louisiana, sparingly Texas, and California.
And other than the state of New Mexico, have you been notified by any other jurisdiction where you had horses that were at Ruidoso that you are under disciplinary or summary suspension?
The did they rephrase the question? I want to make, did they make a penalty or have they made me aware, have they been made aware of a penalty? I want to make sure
No,
I
I'm
answer.
asking you, has any other, you're talking about running horses at other jurisdictions when you were running at Ruidoso. Has any other jurisdiction given you a notice that you are summarily suspended or that you are going to be disciplined as a result of what we're talking about today?
Okay, yes, sir. I understand the question. Yes, only prior to the New Mexico summary suspension, I was racing in Louisiana and Texas and California. None of those three jurisdictions had any problem with the current situation or investigation. However, when I was notified by Mr. Fontenot of a summary suspension due to reciprocity, they have to, or out of respect, state to state, notify it. So California told me that New Mexico had suspended and that they would have to honor that. And we had a meeting for it for about an hour and a half. In Texas, I'm not sure exactly what happened because they have no problem with me racing the horses. And after I was summarily suspended, they allowed a horse to race. Now, I don't know if they didn't have notification, but last Friday night I had a horse named Take My Name. No one contacted me, gave the basics, walked it up there and ran it. No problem. Louisiana has had no problem. Got 5 horses there actually tonight. They said that they would give the courtesy of when this meeting was over, if the summary suspension was lifted, that those horses are more than welcome to race tonight. So the states, to answer your question long-winded, are aware. They have no problem with how I'm doing business.
So let's talk about the, how many horses did you bring from Ruidoso to Albuquerque after the floods?
Approximately 40 horses, sir.
Okay. And when you got to the downs at Albuquerque, where were these horses stabled?
There was, because it was an emergency and the meet here was full, they did give a barn on the, what they call the other side is state fair side. It was on the other side of the actual horse side. So it was in the state fair side of where they house the horses for the state fair.
Okay. And how many barns did you have?
1 full barn, sir.
Okay. And how many horses did you have stabled there?
Approximately 40.
And out of those 40, how many of those tested positive for EVI?
For EIA?
Yes, I'm sorry.
You mean while here at Albuquerque? Yes. 0.
Okay. And after they left, how many tested positive for EIA?
Okay. To be clear, California has a 30-day rule. So the horses that left to go to California from Albuquerque had to be tested in order to be in compliance to go to California. So those horses were tested 2 days before they left Albuquerque, and every horse tested negative. So they traveled to California with a negative test and the proper health paper. Texas has a different rule because Texas has the 1-year Coggins rule. Their Coggins that was in compliance with Texas Animal Health was good. So upon leaving Albuquerque, it was not necessary at that time at an owner's expense to get an additional EIA Coggins test. They were in compliance. So those horses were shipped to Texas on a legal document. The horses that left Albuquerque to Los Alamitos, I did pull a new Coggins on all those horses at a laboratory here, and they were all negative.
What about Louisiana?
Louisiana, after I think the 2 clusters of horses were put to sleep, 1 in Lone Star and 1 in California. State Steward Charles Ashey called me. He said, "Hey, I'm really sorry what you're going through." It was polite, nice. I've never met the man. He said, "We have to do our due diligence. Don't want you to be upset." I said, "I'm not upset with anything. Guy couldn't have been any nicer." He said, "We need you to please pull new Coggins on all the horses that you have here, including pony horses at Louisiana and Evangeline Downs. I said, yes, sir. I contacted the vet. I actually got it expedited, got it pulled the next day, got the results back, and the results of all those tests were negative. Every horse on the grounds at Evangeline Downs had a negative test, and they've taken entries and allowed horses to run the entire time of this process.
When were you first notified that you had a positive test for EVI?
Yeah.
What did I say?
EVIU, that's the herpes, but the EIA.
Yeah, okay.
When was I very first notified of
For EVI.
of the EIA first positive test? Okay, that's a good question. When the horses arrived to Los, I was first to answer your question. I was the first notified by my primary personal vet, Dr. Ashley Troncotti at Los Alamitos. Not by a laboratory, not by a Coggins lab, not by a state, not by FDA. And the reason, can I explain the reason for that? Is basically to this moment now, there would not be any knowledge of EIA outbreak if it wasn't for me and my vet proactively, what I felt like going above and beyond to find out what was wrong with the horses that started spiking temperatures, because they arrived in Los Alamitos with brand new Coggins. Under any law or any rule, that's good for a year. I don't have to take them. Could have sold them, could have done anything with the horses. However, we tested them because a few of them were having minor temperatures, and we could not, they wouldn't respond to the antibiotics, they wouldn't respond to daily treatments. And so her and I discussed it. We tested them for all these other communicable diseases throughout the whole industry to do the responsible thing for the racing industry. They were negative for everything you could do. So then we took it upon ourselves, said, let's test this horse bullet train that Dr. Belzell McCluskey had mentioned earlier. And we retested the horse on an individual voluntary basis, not by force or not by suspicion of any government agency. And we found the horse to be positive. When the horse became positive, she called me immediately. My vet, Dr. Ashley Troncotti, said, I got the results back on the horse. The horse is positive. That naturally rings to the state agency of Dr. Josh Kleppel. And that's what started the whole entire investigation. Had we not taken it upon ourselves to proactively see what was going on with the horses, no one would know of a single horse right now is infected.
Unless somebody else decided to test it.
Yes. How? And that would be, and eventually, but that's the unresponsible thing
Yeah.
to do for our total business, is it could have been a year because those Coggins were brand new. Those horses could have been sold for, it's a little bit emotional is from the standpoint of, you know,
No, it's just
I'm the one that's
Hold
out.
on a second. Somebody's mic, I'm trying to find out who has their mic on. Hold on a second. Sorry about that. No, Richard's fine. There's somebody else that just came on here. Just trying to find them. There's so many people in here. I think everybody's muted now. Okay, go ahead. I'm sorry.
It's a little bit emotional to answer your question from the standpoint of, is I'm out the horses of a lifetime, and I feel like I've just done everything humanly possible to find the source, uh, to help in any type of treatment, to help in any kind of investigation. Lost hundreds of thousands of dollars, millions of dollars in horses, losing owners. People don't understand what's going on. So I feel like having gone above and beyond, being summarily suspended, there should be some type of grace is from the standpoint, I'm the one that's helped get the initiation started, and then just by the letter of the law, done everything proactive you could do from that time forward.
Has anybody from the state of New Mexico, the New Mexico Racing Commission, or anybody from the regulatory body here ever called you and asked you about anything that's going on with this situation now?
No, sir, not one question. Only I was working last Friday, and Mr. Fontenot, I believe it was, called me, and be honest, having horses in that night, having horses in at 3 states that already entered, I wouldn't have been any more surprised if I woke up with my head sewed to the carpet. And he's just doing his job. He picked up the phone and he says, "Hey, I've got to notify you're summarily suspended." And it just, I mean, I was just floored.
So that's the only person that has taken disciplinary action against you at this point in time is the state that hasn't even talked with you.
They haven't talked to me, and I do not have a horse here.
Okay. Well, let's talk about that. You don't have a horse here now. Why? Tell me when the last time you had a horse here.
Last time I had a single horse here was approximately maybe 3 or 4 days. What was the horse? The horse was left on 10/11. What happened on that? The horse had qualified to the Challenge Championship race here.
It wasn't here during.
No, it's not here. The horse is not on Dr. Angela's to watch list. The horse is completely segregated. It's been in California. It's got a complete bill of health. It's not on any quarantine list. It's not on any of her watch list, hold list, nothing.
At the time the Downs at the Ruidoso Downs race meet at the Downs at Albuquerque, where was that horse?
In California.
All right, go ahead.
So the horse was asked to be here in per compliance with the challenge rules on, I believe it was the 15th. It had to be here no, it was, anyway, it was here the day before it had to be here. Mr. Graham, who works for Albuquerque, called and said, "Are you bringing the horse?" Invited the horse, no problem. He said, "Hey, with all this going on, make sure you have a new EIA Coggins test." No problem. I got a brand new one the day he asked for it, stapled to his papers. I believe it was 10/7. I also had the AGID government test from Ames, Iowa, because we took a proactive issue to test every horse at Los Alamitas. Again, it was negative. No problem. AQHA notifies me tomorrow, your horse needs to be at 8 o'clock in the morning to the test barn at Albuquerque for a hair test. No problem. Bring the horse, submit it for a hair test. They choose to do blood, hair, and give it Lasix to my horse and force urine test. No problem. I want to be in compliance. So that's all good. 2 days later, get another call from Mr. Graham. Seems like he's a little bit more revved up. "Mr. Taylor, still don't have a problem with your horse racing at Albuquerque. We want another Coggins test." I think, well, that's probably no problem. The responsible thing to do with all this going on. They pull another Coggins. Dr. Morgan from ESMS comes and pulls the test. The test is negative. So been in compliance with that. It's only one horse we got in the whole state. So it's in every bit of compliance. It's not on any list, not on any watch list. It's as legally here as any horse of the 1300s is here. It's at no risk based on even USDA. She said that earlier. So, okay. Then he contacts me and says, "We're summarily suspending you." I said, "Well, I need to see what my options are to not penalize the owner. It's $265,000 race. You don't enter till Wednesday, Monday or Tuesday. Let me see if I can get a TRO." He says, "Well, you can't transfer the horse because it's a summary suspension." So I had a way to legally potentially get relief to where the horse could have got entered today. And he calls back and says, he's just doing his job. "I'm told to get the horse off the track by 3 o'clock. The email that you got the day before did not come through. I was supposed to notify you yesterday that the horse had to be gone by 3. He was very professional, very nice. In fact, he came up here. I said, "Well, 1 second. With all that's going on, I'm not going to leave the horse here without my papers, Coggins, new Coggins and EIA test, and pyro test to travel down the road illegally. I want to be in compliance." He was kind enough to come in many hours early and he was set
Fun
here,
enough.
yes, and he met the transporter and watched the horse get off the track at 2:58 p.m. by the 3 p.m. deadline. So I was in compliance with that. And other than that, not one person from New Mexico has contacted me.
So where is that horse now?
That horse now is on his way home. He missed this race that he waited a year for. He's on the way home to Louisiana.
Only because, so that horse lost out because you were summarily suspended.
Yes, sir.
And that horse wasn't even here during the Albuquerque Downs and the Ruidoso race meet.
Never a day.
When was the last time that horse was in New Mexico?
I would have to look. It's been a while. As he won the All-American 2 years ago. He ran some as a 3-year-old in the Derby trials. And I would have to look after that.
So that horse was basically
Based in California.
was not allowed to run in this race because even though it wasn't here during the summer, just because you were summarily suspended.
That's the only reason, because he was in compliance of every other way.
Okay.
He worked here last week.
He worked out. And how many tests did he get when he was, so you have nothing in New Mexico at this point in time.
Not a horse.
And let's talk about the horses that went to Los Alamitos, some of the ones that were euthanized. How many of them have been euthanized?
At Los Alamitos?
Yeah.
Sorry. Got lots of notes on this. At Los Alamitos total that are euthanized is the question, correct? Correct? 1. At Los Alamitos, there's been 11 horses euthanized. Yes, sir.
All right. And so let me go back. When the day the race ended here, the Ruidoso / Downs at Albuquerque meet, what were you required to do with all of the horses that you brought up here from Ruidoso?
They were kicked out immediately. The next day, by daylight, they were already took my walkers down. They was already cleaning the stalls that didn't have horses in them. It was, you got to leave right now. The New Mexico State Fair is extremely important here. You've got to leave, you've got to leave, you've got to leave. And so the horses, they had to leave. Every horse was forced to leave the next day after the All-American.
So at the time that all of these horses have tested positive for what we're here on today, none of those horses were in New Mexico. They all had to leave, is what you're saying, what you're telling me. All of them.
Did any test positive in the state of New Mexico?
Yes. No. Afterwards.
After they left Albuquerque, yes, they tested positive at their other locations.
And those were some of the ones in California.
There was horses that left here. The horses that left after the All-American, as we'll say again, California has a 30-day rule. So every horse had a new Coggins 2 days before they left here. They left here with a new negative Coggins based on, I don't know, a lab from here in this state. I don't know what lab. So they're negative, and they went to California. Yes, sir. Later, tested positive.
All right. And since all of this has happened, what have you done? You said you were proactive in California. Were you proactive in Texas?
Yes. In Texas, I spoke every day at length with Dr. Hank Hayes, who you heard earlier that Dr. McCluskey spoke of. He's the Texas animal health person, and couldn't have not have been more cooperative. In fact, when it was done, went over and above, he had a list of approximately 8 horses that they could not locate, that they did not know where the horses were at. I sat down and took the time to find out where they're at. The horse that they mentioned about Veracruz, Mexico, the horses that they've went out and tested at other places, horses that they went to other trainers. I had that information on all those. Subsequently, I followed up with him on that.
So
Every,
you gave these guys,
I gave them the roadmap to go find all the work that they're talking about that's done on the spreadsheet. I was the one that gave them the information to help them. And I didn't give it to Dr. Angela. I gave it to Hank Hayes to the Texas Animal Commission, and he relayed it to her. Subsequently, those horses have all been tested, and every one of them is negative.
so what about Louisiana?
Louisiana, the only requirement was when this became public that horses were getting put down, the state steward, Mr. Charles Ashey called and said, our only requirement is our commission wants to cover ourselves that there's no risk. Said, you're very welcome to race. Can you get me a new EIA Coggins test on every horse? I said, I'll have it on your desk Monday. I had it on his desk Monday, even though that they weren't open till Tuesday. Tested every horse, including pony horses there, and they were all negative. In California, I worked every day with Dr. Josh Kleppel, who she mentioned. We did herd testing over there. After these last horses were put to sleep, we took the time to test every single horse in my possession at Los Alamitos, including the pony horses, with the AGID Ames Iowa Gold Standard test. Every horse is negative. After the last horse in Texas was eradicated that was positive, yes, we're in complete compliance with waiting the 60 days. No one has any problem with that. No one has any problem with in compliance of any bleed. Is every horse in Texas has a negative AGID EIA Coggins test. So to answer specifically, is every horse that I have in the United States of America at a licensed racetrack as of this moment has a negative, even though it's a 1-year rule, has a negative EIA Coggins test within the last 2 weeks, and am completely fine and able to race at every state except New Mexico, where I don't have a horse.
What, so you basically talked to the person who testified this morning, is that right? Ms. McCluskey?
Yes, sir.
Okay, how many times did you talk to her and what information did you supply her with? For
Okay.
how long?
I talked to her at length because the medical director in California, Dr. Jeff Blaya, he's the medical director, came to the barn when we did the last group of euthanasia horses. I told him that I was losing sleep. I was losing owners. I did not know what happened. I just thought as a trainer that I had just done everything you could possibly do to protect my horses. I told him that I had done everything I could do to think of what happened. And he told me of her investigation. He said, I think that the respectful and responsible thing to do is, regardless of who's at fault or what's wrong, is to contact her and voluntarily, which I didn't have to call and take an hour to talk to her, and tell her every single thing that I knew about the situation. One of the things that I did tell her as far as the situation is I'm just a horse trainer. So I'm not going to be an epidemiologist or point the finger at someone. As she asked me general questions. Has the horses that are positive been at one location? So as the conversation went, I started taking notes, and what I come to realize is, whether it's complete coincidence or what have you, is I had 23 horses that were solely at Albuquerque Downs that had a medical procedure done by a licensed vet, completely above board, good vet. I don't know what happened on this same 2 days. The reality of it is 21 of those 23 horses are your dead horses. The other horses that were in the barn here with the same everything, but did not have any work done on them, every one of them are negative. When she cast her net of her spreadsheets and went back last night, I was looking at them and I started counting. 20 out of 20 horses that were at Ruidoso that have now went to other places, but did not come to Albuquerque, did not have any procedure done to them. 20 out of 20 have tested negative. So no one's mentioned horses in my possession like I've done something wrong, that 30 out of 30 horses that weren't here on X day and had X procedure done to them, every single horse to the letter is negative. But yet in 29 years, I've never had an EIA in 10,000 starts. So I feel like my living's being taken away from me and I'm under attack, not only for something I didn't do, but for something that I've never done. And I've done everything you can humanly possible to help or to shed light to it. Again, I tested the horse in California. I didn't have to. I've lost $15 million of horses that I've got to explain to the owners. Well, I was doing the right thing. I thought something was wrong with the horses. And so I've lost the earnings of those horses. So I'm not trying to over portray being the victim, but at the same time, this is a hard pill to swallow.
What else do you know that you could have done?
I feel that's where my frustration is. I don't think that it's humanly possible to have done more from your trainer responsibility, from a responsibility, a care standpoint, a top class horses, proactive testing, cooperate with Texas, spent hours cooperate with California, cooperate with the USDA, proactively test the horses, research the horses back, give the horses to the Texas Animal Commission where they're at, follow all the rules of New Mexico about the one horse. It's not, I've been in compliance. The other states not have any problem with running, and then all of a sudden be hit with this, where we're taking away your livelihood while we try to figure out what happened, even though no one knows what happened. We don't know how long it's going to take for us to find out what is going to happen. And you don't have any horses in New Mexico, and every horse that you have in your possession has a negative test. I see, what's the risk?
You go back, you were talking about, so you did talk to Miss Prezel McCluskey for quite some time. Did you tell her, so what you're saying is that the barn that you had here had 40 of your horses. 20 out of, or 21 out of 23 tested positive and had to be euthanized. Is that correct?
Yes, sir.
All right.
And one died, made it 22, and she said, I think there's another one today. Because, without looking at the numbers, I don't like to be misquoted, but that, yes, that every horse is going to end, except for the relentless tulip that's tested negative.
Okay. One horse that tested negative. And the other horses that were in your barn, the other 13, did not receive any procedures from this particular veterinarian. Is that what you're saying?
Yes, sir.
And they were in the same barn, came up the same time, they've been here the same amount of time, and none of those have tested positive.
Yes, again, I'm not saying what happened, but it's not one horse of those other horses here has ever tested positive. They've been negative every test.
So it's just these 23 who received the same. Well, let me ask this, did they receive the same procedure on the same days?
They received it on the 29th, 30th, and maybe one or two of them the 31st, but the same cluster of times. So it's just those horses, just those days for my whole life.
And so now, other than the unbeknownst that we may not know anything for the next however many days, all the other horses are negative.
Yes, and every horse that I currently have has a negative test.
Who else did you talk to? I mean, you've listed a number of other people. Are there other people involving state agencies, whether it's, did anyone from the New Mexico Livestock Board talk to you?
Zero. No one from New Mexico in any capacity beside the steward to notify me of the summary suspension. All other states have contacted me And I've, again, over the top, helped in every facet and answered every question. In Texas, 2 investigators. I've answered their questions. And here, no, sir.
Let me go back to this thing about, I remember, Dr. McCluskey talked about the 2 horses, that they didn't know where they were at. Is that right? And on that spreadsheet, I think we looked at them and, one of them was Boogie-like.
Yes, sir.
That's on the spreadsheet, right? And, sent in a favor, right?
Yes.
And on the spreadsheet, it says that they really didn't know where they were at. Okay. How did they find out where they were at?
Okay.
And what has happened to those 2 that they had no clue on?
Dr. Hank Hayes from the Texas Animal Commission called me with a list of approximately 8 to 10 horses. Those horses were on the list that he sent me. I knew that the bougie-like animal had been sold, and the people that bought the horse, it left Los Alamitos, California, legally with the proper health papers documents. And after they paid for the horse in full, they indicated that the horse was going to go to Veracruz, Mexico. So how and when the horse goes or where he crosses, obviously I have no idea. However, I provided them with that information. I also provided them with the information on many of the other horses on the spreadsheet that they had no knowledge of where they're at. They had no way to find out because there was no more equibase numbers. And he graciously thanked me many times for helping them find those horses and doing the responsible thing so they could go out and find where the horses were and test the horses.
Why wouldn't they have showed up on the equibase?
Well, they had left. They had left here and they had left Texas, so no one knew where they were at. They were no longer in the active backside of a track, like working, or maybe they were preparing for a sale. Maybe they were preparing for a second career or what have you, but they weren't active in racing anymore. So I helped him find all those horses, and I'm sure he would corroborate that. He's a very nice man. I've worked with him, and he's thanked me a zillion times. That's why I was floored by the summary suspension, is not only the cooperation, but for the gratitude that every other state has shown in helping. I was just blown away to get that call.
I may have asked this before, is it, so from the time that you got the first call that there was some, well, let me go back. I take it what you're saying is that you and your people in California were the ones that discovered the first positive test.
Yes, sir.
Okay, run that by me again, how that happened.
Okay. The horses were tested here at Albuquerque before they left. We waited for the results to come back, and those horses, I believe there was 7 on that particular trailer, maybe 8, I can't remember the number, all tested negative for EIA Coggins right here. Got a proper health paper, sent the horses to California. After they first arrived at California for a few days, some of them showed minor temperatures.
What do you mean minor temperatures?
101.2, 101.3. Originally, it's very common for horses that travel that far for the first week or so to pop temperatures because of shipping fever or changing out, just different things. So no one thought, I mean, this wasn't even on the radar of even consideration of a problem. So we treated the horses, and the horses, some of them, the vets there thought was just a virus. It's just a normal virus that they get when they ship. Don't worry about it. You're being overcautious. But I checked the temperatures again. I knew the temperatures were different than what they had all summer. So this kept going on and on a little bit. So then we tested the horses for, I mean, incredible amount. Took the responsibility. We scoped the horses. They scoped clean. We ultrasounded the horses. They ultrasounded clean. They had no cough. They had no mucus, just kept minor. So we're spending thousands of dollars every day trying to figure out what's wrong with the horses. She's running allergy tests. She's running the herpes test. She runs every test you can run on the horses, and every test on the horses is negative, but they're not responding and getting well. So she talks to me and says, well, the responsible thing to do is, even though they have a brand new one, is we need to test them again for EIA or pyro. So we tested the horse. I had said, okay. So she tested the horse, and that was what indicated the first positive. And that's how he had a Coggins EIA negative within 3 weeks of that. That would have been good for another 11 months. Had she and we discussed it, tested the horse for that. There would have never been a test on the second one, third one, fourth one. No one would know right now. So we're at such a huge loss.
Well, unless they would have ran or something.
Well, if they would have ran, that wouldn't have been a test. If they could have went to the test barn, they could have run all year and nobody would have known it. They could have run for 1 year, not known it. Could have went to any public sale and spread the disease possibly. But the responsible thing to do was to check. And then after we checked, obviously we were immediately in compliance with the California, and they came out. And then that's when we tested the rest of them and found the other positives. Same thing in Texas. Okay. The Texas horses arrived at Texas with the Coggins that they had prior. Okay. They didn't, it's not a Texas rule. I think this is very, very important. Very, very important as to my credibility on whether I should have any summary suspension. Is when we get the indication in California horses positive, a couple of horses in Texas had not, at that point in time, they had shown nothing. They were pictures of health. Well, we get the first or second positive in California, and I thought, man, this might be a problem. We need to do the right thing for the horses and the right thing for the business. So I immediately triggers me, and I call my private vet, who's the same vet that came here and did the procedure here. We need to test proactively every horse that was at Albuquerque that's now at Lone Star, because I couldn't sleep at night. I mean, people are telling me, well, don't test them, fool. That's $600,000-$700,000 horse you can sell. If he's got a new Coggins, you can sell him right now for $600,000. But if he tests positive, you're going to have to put him to sleep. So it's not the right thing to do. You got to do the right thing for the business, right thing for the industry. So I order those tests that Dr. Angel was talking about and send them off. On the 19th of September, I'm provided 14 or 15 legal federal documents saying that the horses are negative. I could have come and picked the horses up right then and took them anywhere in the world to any race, any track, and not been done any doing of any wrong. Left them there. And as she testified, I believe 7 of them were provided to me on a fraudulent document. That's a laboratory problem. That's a regulatory problem. That's not a Heath problem. I tested them voluntarily. So those
The laboratory came back and said there was something going on.
well,
What she said.
yeah, she's saying that the lab provided us, and so then they went and the state tested them, and when the state become involved to test them, then all this broke loose with the fraudulent paperwork with the lab, which I have nothing to do with. I don't even know what lab that they send them to. That's not anywhere in my pay grade.
Let me interrupt just one second, my stomach, so just take just a 2-minute break. Sorry,
Okay,
guys.
all right, thanks.
That's
okay.
It's
What did you eat last night? Don't tell me.
ain't good.
I understand we're taking a break.
Yes, we're taking a 5-minute break.
All right, thank you.
I don't know that we need. Let's go outside. He's got issues.
Anybody?
I got you.
Richard? Okay. Are you there, Richard?
We can hear you.
Okay.
This is
you
Denise.
go
This
ahead.
is Denise.
Okay, go ahead and proceed with it.
All right. Since, do you know what date it was that you got the positive test that you took upon your own doing in California?
I would have to look at the exact date, no, but I know that we started immediately at that point notifying officials, and then they notified us what the procedure was, and we immediately were in correspondence and been on it ever since.
Since that date up until today's date, have you done anything other than work and cooperate with these individuals?
It's been far more overwhelming than actually working training the horses. 12 to 14 hours a day on phone calls and answering questions and interviews and anything possible to proactively help. It's just been overwhelming.
And if any official from New Mexico would have ever called you, other than these nice gentlemen here, would you have been showing them the same courtesy?
Absolutely. I think that when you're talking about absolutely, I think especially when you consider now that they had imposed the summary suspension, I feel like all the other states that are openly letting me race every night. There's 5 horses tonight in Evangeline Downs that the stewards are kind enough to say if the summary suspension is lifted, we're not worried about EIA 0. You can race the horses. Same as 2 horses tomorrow in Dallas. Their officials have called. So to answer your question, I would have been more than happy to answer any question with anybody involved at any point with the New Mexico Racing Commission, because I think all the other states have all the information, and therefore that's why they're allowing me to run in Texas. That's why they're allowing me to run in California. That's why they're allowing me to run in Louisiana, because they know that all the horses are negative now. It's a terrible black eye for racing. It's a terrible black eye for me. I've lost probably 3/4 of my business. People are scared. People are worried. It's misunderstood. So it's incredible. But yet, to answer your question long-winded, I would have obviously cooperated with them. I feel like I've cooperated with everyone else that's asked, and in all 3 of those racing jurisdictions, they're ready for me to race tonight, and there's no problem.
When you talked to Dr. McCluskey, how long do you think you talked with her on the one or two occasions you talked with her?
45 minutes to an hour was a guess.
Did she ask you about sabotage?
Yes, sir.
Did she ask you about the boogeyman?
Yes, and in that aspect, meaning ask the boogeyman as rogue employee or someone of unknown origin. She asked about the retaliation. The reason, and she said that I indicated, and they really honed in on that they thought that probably wasn't, they asked me and I said I didn't feel that it was very possible, is because we had such a high value of horses here at the track, and they say to be your insurer and take care. I had 4 night watchmen stay at the barn with the horses. So I don't know how much more a guy can do other than remove his refrigerator and his TV to the horse's stalls. I mean, I just don't know what more a guy could do.
What do you mean you had 4 night watchmen up here?
I had 4 guys. We were put in the portable stalls of the fair. You can open one of the gates and hear it from here, is how loud the gates rattle. So for someone to sabotage the horses and it be the exact same horses, and again, I'm not Columbo to say it's not my spot to solve the mystery, but for it to be the exact horses that got worked on and the exact stalls and the same 23 horses, the probability of sabotage to come in there and pick those exact horses, but every other horse standing beside them being negative, it in the dead of the night, it's not very likely. And then no other horse that came here that's on our list, not one horse, 30 for 30 is negative.
So what,
30 total. I said that's a misquote. 20 that she has on her list that didn't come here, and the 10 or 13 others that were mixed in with these. So my thinking at the time was, before this continued to get more, I thought I was helping and being proactive. I didn't know I was on the defense to say, well, I don't think. I was trying to help her. I tried to help her solve the case or have ideas. And her last thing was, thank you. If you can think of any more theories. She said, I'm not saying your theory is right or wrong. That's up to them. I'm not, but she said, I'll take it in consideration. And I gave her all the information. So at the time, I didn't know I was being suspended or on the defense of anything. I didn't think that the sabotage was a particular possibility.
why did you hire 4 people to watchmen to be in charge of your barn?
Okay, because we were going to run in the trials of All American Futurity. I'd qualified 2 to the Oaks, 2 won the Oaks, won the Ruidoso Derby. The grooms, some of them, they stayed there. They stayed there, and the grooms served as night watchmen, and they switched off just because of the value of the horses. If a horse colics or gets sick in the night, you can save its life by catching it quick. A horse rolls up on the wall in these portable stalls, gets a leg in between the bar, and you can hear it. If you get them up quick, it's not a problem. If they stay stuck down, we were running for a lot of money. So that's the other thing is, all this, what it encloses, you're the absolute insurer, is I feel like that I've done everything humanly possible above and beyond to do that, to protect my horses and my owner's investment. And who would ever think, just from simplicity, who would allow even the potentiality of any procedure or something to be done that would risk their own horses and 40 years worth of work to get horses of that value? That does not make any sense. A trainer of worth his salt is not going to take a risk to do something like that, and then in turn say, it's never happened before in 29 years. It's not happened any after that on any of the other horses that they've tested under any kind of circumstance. So to be summarily suspended, I mean, my horses have now been tested with the AGID test to be a risk for health or safety for New Mexico. Is every horse in the population that hasn't adhered to the directive that they've put out, is it more risk than the horses that I had? There is no risk. The problem is, now we're getting toward the end of that 60 to that 90-day time period. The horses have been contained. I've kept them exactly where they're going to be. They've already had their first negative test. They have to be in compliance, some of them, to get their second test. No other state has any problem with those horses racing. Apparently only here, and I don't have a horse here.
As, just for the purposes of the record, any of the places that these horses any of these places that these horses raced or went to afterwards, have any of those states shut down? Have any of those tracks shut down?
No, sir.
None. Is that right? All right. Were you racing in Sunland Park in 2016?
I think we might, but possibly we're going to ship our horses out for some stakes, but with the outbreak and stuff, I do not think I had horses there at the time.
Are you aware that with that EHV outbreak there, that racetrack was closed for some 2 to 3 months?
Yes, sir. It broke many of my friends financially.
Are you aware as to whether any trainer
veterinarian or anybody associated with racing in New Mexico was disciplined or summarily suspended as a result of the 3,000 horses that had to be quarantined?
To my knowledge, not a single person.
I have nothing further. Maybe, I don't know if Paul has anything on that.
Let's go.
I don't, thank you.
You don't have any? Okay, Richard, do you have any questions from Mr. Taylor?
Yes, thank you, Mr. Fontenot. Good afternoon, Mr. Taylor.
Hello, sir. How are you today?
I'm very well, sir. Thank you for asking. You had mentioned earlier, if I heard you correctly, that when the Ruidoso meet moved to the Downs of Albuquerque, that you basically brought 40 of the horses that were under your care, custody, and control. You brought them from Ruidoso to the Downs, right?
Yes, approximately that many, counting pony horses and other horses. Yes, sir, approximately.
Hold on one
Okay.
second, Richard.
Yes.
You're actually real low talking. Is there any way you can move closer to your mic? Because we
Yes,
can
I'm-
barely hear you here.
Okay, I'm sorry. Is that better?
Yes, sir,
Yeah.
a little bit. That's
Okay.
why I was ducking down. I
Okay,
apologize.
I'm sorry. Boy, usually people don't tell me I'm quiet. So anyway, Mr. Taylor, with respect to those 40 horses that you brought from Ruidoso to the Downs of Albuquerque, did any of those horses end up being euthanized? In other words, were any of them the 23 that were euthanized or the 20?
All of them.
Okay, all right, okay. And I take it when you moved, you ran at Ruidoso, right?
Yes, sir.
Okay, and did you continue to run horses when the Ruidoso meet moved to the Downs of Albuquerque?
Yes, sir.
Okay, and did you run horses at the Expo New Mexico meet?
Nobody State Fair.
No, I did not, did I? I left as soon as the day after. Oh, I was kicked out as soon as the All-American Fraternity was run. I was kicked off the property the next day.
Okay, and if I understand correctly, I just want to make sure that you were actually planning on running a horse in an upcoming race at the Downs of Albuquerque, correct?
Yes, the horse had qualified and I had been invited here and I was going to bring one horse here to race. Yes, sir.
Right, and then you mentioned that specific horse, in fact, actually worked out at the Downs of Albuquerque just as recent as last week, correct?
Yes, sir.
Okay. And Mr. Taylor, earlier you mentioned that a vet you work with performed a license procedure on 23 horses at the Downs of Albuquerque. And unfortunately, 21 of those horses ended up being euthanized. Is that correct?
Yes, sir. At this point, that is correct.
Okay. Who is that vet?
Dr. Steve Holbert from ESMS.
Okay. And had you worked with that vet for a while before those 23 procedures?
Yes, 20 years plus.
Okay. After the incident occurred where he does this license procedure on 23 horses and 21 end up euthanized, are you still working with that vet or have you fired him?
Right now, there's some owners that have declined. There's some owners that are not pleased that have declined to use the veterinarian anymore. Currently, as I had said earlier, sir, I'm not the epidemiologist or investigator, so I've been open-minded. It's a good person. It's a good vet. It's a good man. It's been a good friend. I don't know what happened. So until further notice, I'm not going to throw 20 years of friendship and working relationship out until I knew more. So yes, sir.
Thank you, sir. And being that you've been a trainer for close to 30 years now, is it safe to assume that you're familiar with the rules and the concepts regarding absolute insurer and trainer responsibility?
Yes, sir.
Okay, all right. And yes or no, Mr. Taylor, if you were a trainer that we're not facing this EIA outbreak in horses under your care, custody, and control. If you were a trainer and you had a barn full of horses that were in your care, custody, and control, and you were next to a trainer who had the EIA situation you're dealing with currently, yes or no? Would you as a trainer be concerned for the health, safety, and welfare of your horses if you're based right next to a trainer who is having the EIA issues that horses under your care, custody, and control are having? Yes or no? Would you be concerned for the health, safety, and welfare of your horses?
No, zero, especially if I knew that the horses in the adjacent barn had a AGID government gold standard Ames, Iowa Coggins test. I would be zero worried.
And given the fact that you've been in the industry for quite some time, and you've clearly been working with the USDA vet on this matter, you're aware that EIA is a transmittable disease, correct?
Yes, sir. I understand that.
Okay, all right. Okay. Thank you, Mr. Taylor. I appreciate it.
Yes, sir.
Do you have any more questions? I'm gonna follow up on that. I think we understand, but I just want to clarify this one more time. The horse that was here in Albuquerque that just left the other day was never here at any point in time until 2 weeks ago.
So that is correct. And based on what he's trying to press upon, which I'm respectful, saying that people are worried about it, that horse running in this race, they already had the USDA woman testify early this morning that the horse was at zero risk. It's on no list, and it was very welcome to be here. They proactively removed the horse.
You had that, and actually, when the horse was tested here again for the second or third time, did you use the same company, the same veterinarian company that this veterinarian works with now?
Yes, sir. Dr. Morgan from ESMS, his umbrella company, came because they asked for, I knew the horse was negative because he had a 10-7 Coggins stapled to his papers. He came from an area of every horse was negative. He'd never been to Albuquerque. He'd never been to Ruidoso. He didn't have any medical procedures. He had he had the government AGID test when they come and tested the whole herd. So I doubly knew he was. So when Mr. Graham called and said they're requesting somebody. Don Cook, the general manager, in order to protect the other participants, wants another test. I said, absolutely. I immediately got the test and I immediately provided to them that it was negative as soon as I got the results the next day. And then after that, I was at complete like I said, it is complete floored when he called and said the suspension. And then when I wasn't allowed to transfer the horse and penalize the owner, knowing it had 3 tests, I felt that is my opinion, and the horse not being on any list. The horse has nothing to do with the case. And then to have the horse forced off the track.
For something that horse qualified on based upon what happened.
And has nothing to do with it. Even the USDA woman said this morning he's not on any spreadsheet. He didn't come from any. He's as eligible for the race as any horse that walks out there.
So let me ask you this, and then that horse left and is no longer here.
It's no longer here. The owner lost opportunity of $265,000 race that he's been waiting a year for.
Mr. Bustamante asked you to put yourself in a position where there were other people out there that if you knew that they had this issue, if you would be have a problem with. You've been racing for how long?
28 or 29 years.
And you've won all these awards, right?
Yes, sir. Been trainer of the year, been leading money earner in the nation the last 2 years. one of only 3 people that's ever lived that's won more than one All-American and more than one Champion of Champions. I think there's 3 people that's ever lived that's done that.
And so so are, are your owners still standing by you right now?
They want to be, but they're very confused and don't understand why 3 other states are allowing me to race, but yet somewhere where I don't have any horses is summarily suspending me, when the horses now, they feel like that I've done above and beyond in order to eradicate the problem, not only cooperate, we went through that, but now all horses in possession are negative. However, yeah, financially, it's beyond crippling as you work 40 years to get to this point, tend to educate yourself, 29 or 30 as a trainer, and then be summarily suspended over something that you've done everything you could do to. There's nothing more that you could have done to prevent it. There's nothing more that you could have done to help. And you've worked through the problem. The horses all test negative. The problem is basically, it's either that or it's contained. I anticipate no other positives, because there's no other horse out there that, whether that's the case or not, again, and I'm not blaming it on the veterinarian. I'm just saying there's no other horse in the country that fits the profile. It was worked on that day at this barn that has been positive with the other horses, where yet every other horse, for not just this year, for 29 years it's been in my possession, has never had an EIA test other than that particular deal, before, after, or during, at any other place. Is I feel I'm zero risk to safety of racing.
If there were to be conditions, like, don't come to, we're going to lift this summary suspension, even though we don't even know if there's going to be a disciplinary hearing. You haven't been notified of any of that. Do you have any horses that are scheduled to come back to New Mexico at either this Downs meet, what's left, the meet in Zia, and the meet in Sunland Park this year?
This year, I have no horses scheduled to race at Albuquerque. I have zero intentions to start a horse at Zia. At one time, I had considered, before all this happened and the stall application is not even put in, of taking some horses to Sunland. However, we have not made any stakes payments into those races, and I'm sure that that's a very fluid, flexible situation. So to answer your question, no.
And right now, I guess you don't plan on coming back to New Mexico in the near future as it relates to these matters going on now?
No, sir.
Not for those next.
Not for the next.
I guess my issue is that we're still waiting for the Agriculture Department, or USDA, to complete their investigation, which may be 2 months minimal, 6 months maximum, maybe even further than that. For them to even come to a conclusion, or, no other state, the only state that you would probably be not, that you would have disciplinary action in would be this state, and you don't plan on coming back here, that you're a risk to anybody else where all your horses tested negative and none of these owners are pulling them from you, right?
They're wanting the best they can be to be supportive, is why today's summary suspension potentiality of being listed with or without terms is so important. I'll have legitimately, when we leave here, 80 owners will call and they'll want to know what is the plan and what is the plan right now. And those involve all the other states except here. It doesn't involve here, zero. So I'm certainly at zero risk to harm New Mexico Racing Commission in any time in the short term. And certainly I would feel like, to answer your question, in the time that it takes for the USDA to come to a conclusion of what the finding is on the investigation, but it's financial, emotional, disaster and I can't even put a dollar value on it, because if you say you're suspended here and that makes you suspended at other places, your whole entire year of next year's yearling crop, you have to decide right now where you're going to race them, what races they're put in. And if they're put into races where you can't participate, then a ruling that's based only to wait till investigation is astronomical dollars. It puts you out of business.
Everything for them. Good.
What about, Mr. Paul? Do you have any questions?
I do not.
Okay, Richard, do you have any other questions?
No further questions, Stuart Fontenot. Thank you.
Okay, would you like to go ahead and, well, thanks for your testimony and everything. Would you like to go ahead and make a closing statement? Richard?
Yes, Stuart Fontenot. Yes, thank you. First of all, Honorable Stuart, thank you.
You don't have to speak. I don't know what's going on with your microphone. It was good
I
earlier. Now
apologize.
it's not too good.
Okay, is this better?
Yes.
Okay. First of all, Honorable Stewards, thank you so very much for the significant amount of time that you have dedicated to this summary suspension hearing. We all appreciate it very much. And gentlemen, as you know, the hearing here is to determine the sole issue is whether Mr. Taylor's license should remain suspended pending a final disciplinary hearing and ruling. So let me start off by saying that the USDA is obviously leading and conducting this investigation, given the fact that several states are involved. Therefore, it's an interstate investigation. And clearly, the USDA has more resources as part of the federal government than any New Mexico Racing Commission or any other state racing commission. Let me submit that, quite frankly, it is irrelevant regarding what any other racing commissions are doing in other states regarding Mr. Taylor's license. We are dealing with his New Mexico license. And as you know, stewards, a license granted by the Racing Commission is a privilege, not a right, basically. And so here we have the situation where basically Mr. Taylor is responsible for 23 of the, I think 103 cases nationwide so far of AEI, approximately close to 20%. He specified that the 40 horses he brought from Rio Doso to the Downs, that 20 of those are now are dead. And he was planning on running a race this coming weekend at the Downs of Albuquerque. This is all done in the context of a huge cluster of EIA cases tied to horses that are in his care, custody, and control. The doctor from the USDA testified that they have reached the conclusion on transmission, but not the source, and that transmission is in no way, shape, or form insect, just given the fact that an insect, it can take years and years for a horse to develop EAI from an insect bite. And so you have the situation where basically multiple horses have come down with EAI and have been euthanized. And yet Mr. Taylor was still wanting to run in a horse this weekend at the Downs of Albuquerque. Basically, the summary suspension rule 15.2.1.9 A3A states, if the stewards determine that a licensee's actions constitute an immediate danger to the public health, safety, integrity, or welfare of the horse racing industry, the stewards may summarily suspend the licensee pending a hearing. You heard from both doctors from the USDA as well as our regulatory vet here at the Racing Commission that a negative Coggins test does not necessarily translate into that horse being free of the virus. Rather, that horse can still have that virus within them, but enough antibodies have not been produced by that horse such that it would produce a positive Coggins test. And given that reality, Shockingly, and with all due respect, Mr. Taylor at one point said, "What's the risk for allowing me to race?" Then later on, he said, "I'm zero risk to the safety of racing." With all due respect, and then he further said, in response to my hypothetical, "Would you be concerned for the health and safety of your horses if you were housed next to a barn with a trainer that had the type of EAI situation he's currently dealing with?" And he said no. With all due respect, that just strains credulity. The bottom line is that given the reality of Mr. Taylor's situation, of the number of horses under his care, custody, and control that are dealing with EAI, the number that have been euthanized, one has died in New Mexico, several more are in quarantine. Clearly, and with all due respect, the commission respectfully submits that there is clear and convincing evidence that summary suspension and continuing the summary suspension is the correct decision. Because with Mr. Taylor's history that he's currently dealing with of EAI, he clearly constitutes an immediate danger to the health, safety, integrity, and welfare of the horse racing industry, because essentially the disease is transmittable, and basically it can be a ticking time bomb in horses. So respectfully, stewards, the commission requests that after deliberation, you make the right decision and continue Mr. Taylor's summary suspension. Thank you all very much.
Okay, thank you, Mr. Black. You want to do it or
I
Paul?
was gonna ask, is Paul gonna?
Hey, Paul, Mr. Paul, do you want to make a closing argument, statement?
No, I'll leave that to Mr. Blackburn. I can't quit coughing.
Okay, all right.
Thank you. I don't want to take up any more of your time. You guys are professionals. You understand a lot more about this than people not being able to figure out for the 200th time this morning that this horse that was racing at Albuquerque, that Mr. Taylor said wanted to run, was a horse that had never been here for quite some time, and was a horse that was awarded the possibility to come run here. But he did everything thereafter to make sure that thing was okay. But that's not in the future. It's interesting that all these places where the have horses are still allowing him to run. We understand that when you go through a full disciplinary hearing, when you have the right to be in front of a fair and impartial hearing officer, and when there's a disciplinary hearing and they hear all of this stuff over 2 or 3 or 4 days, it happened to be that one of the cases that I did that involved Mr. Heath Taylor lasted in front of the Racing Commission for almost 5 days on the All-American several years ago with Mr. Wyndham. And under those circumstances, if he would have lost that, then he would have been suspended and not been able to participate again. But we're talking about a summary suspension where I think speaks for itself that as to the risk involved, that other states are not even talking about suspending. And it doesn't mean that in this particular circumstance that things may not be different, that he may be able to face some type of charges, disciplinary action for, there's no positive test. If you look at the trainer responsibility rule, and if you look at the rule that they cited under the use of horses or the protection of horses, it mostly talks about positive tests. And they're for prohibited or substances or otherwise on medications that exceed the maximum limits. That's what most of those things talk about, because there is something to look at in those matters. And I mean, I think, and clearly, I think it's I've argued about this for a number of years, that our trainer responsibility rule says that you are responsible for the acts of third persons. I guess if there was a reason to believe under the circumstances, you take that to its most individual logic. If indeed the USDA would have come back and said that it was a fly, well, that's, I mean, for third parties or something. And I don't know what Mr. Taylor could have done after this came out, that he could have done anything more than what he did. The whole purpose of this hearing, I mean, is stated is that whether his license should remain suspended pending a final disposition, which may be for the next year, 2 years, or maybe for life, for what I heard, forever. They don't know. That he be suspended. We don't even know that there's going to be a disciplinary hearing. If that's the deal, then let the summary suspension. It is different. I understand if he goes to a disciplinary hearing and he loses, then that affects him in other places. I have a ton of cases, well, not a ton. I don't want to make that sound bad. I have a couple of cases where they have been suspended here and they can't race in other places. But that's after a full-blown hearing, and usually after it goes through an appeal process. We're not even there under the circumstance, and to make him sit around and wait for them to find something out when he has minimized his participation here, and he's been welcome in 3 or 4 other states. So lifting, and you are punishing these other people, or New Mexico is punishing these owners in other states that they can't transfer horses or enter in those races because of the summary suspension here, where he hasn't had a full-blown hearing. And there's no reason to keep this summary suspension in effect. What more can he have done in the meantime? I mean, first of all, no one even knows. I think we have competing interests as to what the source of this is. But somebody who goes out of his way to bring 4, he hires 4 people to put in his barns to make sure that they're not sabotaged, to make sure that everything goes okay, to make sure in the middle of the night, if the horse rolls over, I mean, he's gone above and beyond the call of duty. Now, we have this situation, which seems to me, from sitting here for the last several hours and several breaks, that there may be an issue with this vet. We don't know. I mean, they're not even willing to call that at this point in time. But again, there has been no showing that they would, if they were to make even at a disciplinary hearing, as to what Heath did that caused this. And coincidences seem to point that there may be something with the vet who lied to Heath, as I understand, and they went and got tests in Texas that somehow that lab that he has nothing to do with. You know how this goes. Those people pick the lab. We don't get to pick the lab. I mean, unless it's a what do you call it?
Split.
A split, right? And they pick the lab, and the lab comes back false. I mean, fraudulent. Like, is the Racing Commission in New Mexico trying to say that somehow Heath Taylor controls that? But there may be something with the vet. But that's not Heath Taylor. So I think that there is no harm in the punishment that is coming to not only Heath, but to other individuals, owners, who are going to be punished by doing this summarily suspension when we don't even know when it's going to end down the road. And, I've been involved in things with the Racing Commission. It's not like they turn around and schedule a disciplinary hearing within within a month that they give you the notice. And sometimes those, as you well know, take up to a year to get a hearing officer and all of that. But, then this could go on for probably 2 years summarily suspended. Which I think is unfair to everybody. And I could go on and on and on. You guys know the rules. You know the sincerity of sitting here listening to him, what he has done, and everything that he has done. I don't know what more he could have done. And if that is going to be the standard now on, that when you cooperate, the signal that's going to be sent to all of these horse owners and all of these trainers out there is, you know what? Why should I cooperate? Why should I sit down and tell you, the USDA, what's going on? Why should I do that if in the end I'm going to be summarily suspended or I'm going to face disciplinary deals? And in fact, what is most striking is the state that is trying to do this has not even had the balls or the guts to come talk to him and find out what they thought he did.
And not trying to race here. Don't have horses.
And I have nothing further. I'm sorry.
Okay. All right, Don, do you have any questions or anything you want to state? Which we should have done that before closing arguments. I don't have anything.
No, I have no questions.
What about you, Reese? Rod? You're muted. Hit unmute.
No questions.
Okay, I apologize that we should have done that before, so. All right, so at this time right now, it is now 12, we say 55 PM, and this hearing is adjourned. Thank you all.